Those who are listening in, welcome. Remy, will you please call the roll?
Yes, definitely. And just to start off, our agency directors are going to be arriving at about 10 a.m. So that includes Dave Baden, the interim director of the Oregon Health Authority, Ben Cannon, the director of the Higher Education Coordinating Commission, Colt Gill, the deputy superintendent of the Oregon Department of Education, Liesl Wendt, the deputy director of the Oregon Department of Human Services, and Alyssa Chatterjee, the early learning system director of, can I say Department of Early Learning and Care? I'm going to go ahead and say DELC. And Andrea Bell, the executive director of Oregon Housing and Community Services, is excused today. So now we'll move on to the roll call for our the rest of our council members. Angie Blackwell is also excused today. Katie Brooks.
Present.
Thank you. Peter Buckley.
Here.
Thank you. Ann Kubich.
Here.
Thank you. Kali Thorne Ladd is excused today. Dr. Peg Miller.
Sure, she is coming.
Yeah, we know that she is on her way. Probably something at the hospital. Subin O.
All right, here.
And then of course Sue Miller, chair.
Here.
Thank you. And it looks like we have a quorum.
Great. Thanks, Remy. Okay, council, we have another exciting, as always, meeting today, and we're going to be winding up a lot of the work that we've been doing over the last 6 to 12 months, actually, when we adopt our Raise Up Oregon strategic plan, and we also adopt some very, very important rules for the whole early learning and childcare system. So lots to do today. And we're going to lead off the meeting today with an update on the home visiting system initiative that we launched just over a year ago, actually. It was in March of 2022 that the council said we want to form a home visiting system committee and really start diving into the prenatal to 3 age group and look at the home visiting system as a way to really support the launch and the very beginnings of what's going to be an early childhood system in this state. So we're fortunate that Peter Buckley and Peg Miller, 2 council members, were willing to step forward and chair this new committee for the council. Thank you, Peter, and thank you, Peg, when you jump on the call. So at this time, I'm going to just turn it over to Peter to lead us off and introduce Susan and
Great.
all of that.
Thanks, Sue. Well, I have the pleasure of introducing Susan Fisher Mackey, who's serving as a lead consultant for the home visiting system. I've had the advantage of being able to work with Susan for a number of years now. She was previous with All Care Health, one of our coordinating care organizations in Southern Oregon. She is a fierce advocate for early childhood education services, passionate about the work and very creative in how she goes about making things happen. So with that, Susan, I'll just do the official welcome to you and hand it over to you.
Thank you so much, Peter. Remy, if we could go ahead and launch those slides. Thank you, friend. Well, we are going to spend just about the next 51 minutes talking together about progress that's been made on your Early Learning Council's Home Visiting System initiative. And Remy, if we go to the next slide, where I really want to center us is that Oregon's home visiting system is a constellation currently in motion. And there are many different groups who truly care about the well-being of the children and families served by both formal, large, robust home visiting systems, as well as community-based, smaller, more organic home visiting systems, right? And so if we think about the partners in this adventure, we have you as the Early Learning Council. We have the Early Learning Council Home Visiting System Committee that Peter and Peg co-chair. We have a home visiting system planning team, which is largely made up of funders who are working to ensure that progress continues to move forward, that the momentum from the working team's recommendations are able to, that momentum is maintained, and that we make meaningful progress together. And then there's two other entities, and a leader of whom you're going to meet just a little bit later in the presentation. But the first entity I want to speak to is the collaborative. And so the collaborative historically has met as a group of home visiting program managers and supervisors to share best practices, to network. We know that often when we set those tables, there's a lot of joy shared as well as some consternation. And so the collaborative has become a very meaningful space for representatives from a lot of Oregon's home visiting programs. The collaborative is currently chaired by Heidi Groger of the Department of Early Learning and Care's Home Healthy Families Oregon program. And it's the collaborative that will be stepping into also holding the role of providing advisement to the ELC's Home Visiting System Committee and subsequently the council on how do we continue to move forward well with our home visiting system work here in Oregon. Now, as we talk a little bit later about the collaborative, we have some additional work to do to ensure that the representation on that group is diverse, right? Thinking about cultures and languages, geographic locations in our state, as well as, again, the representation of more formalized fidelity models of home visiting, as well as more community-centered homegrown models. And then the last partner that you're going to hear about today, and Beth Green is here to share about our State Home Visiting Coordination Center, which will be based at Portland State University. So Remy, if we switch to the next slide, I just want to remind the council that the recommendations of the Home Visiting System Committee's working team centered on financing, home visiting workforce, regional and state structures, as well as aligning legislation and rules, with different subcategories under that of really identified key early wins and some longer term goals. Primary to that is investing in relationships, thinking about ongoing training and reflective supervision for our workforce, creating family-centered, easy access entry points, and making sure that we're all rowing together to bring forward meaningful policy and funding change. The image that you see on the screen right now is from FSG, and they lead work on collective impact initiatives. And really, they put forward a wonderful paper. The hyperlink is going to be available to you through the slides around 6 conditions of systems change. And I'd like us to just hold space for these as we navigate these conversations together over the coming months and years. As we gather together and we think about systems change, it is often easiest to talk about policies, practices, and resource flows, right? Structural changes that are largely explicit and easy to access. Sometimes those feel really gratifying because we can make quick progress on those. But progress can oftentimes take place in a silo if we don't look at some deeper levels of system change. And so if we think about that, one of the examples that all of the entities involved in helping transform Oregon's home visiting system are really committed to relational change, right? These are pieces around relationships, connection, that's how and when and where we meet, what is the pacing of our meetings, and power dynamics. Be those power dynamics that are articulated somewhere in a 2-dimensional document in black and white, or that are perceived. So power dynamics are a large part of what we're centering and talking about as we're thinking about how are we living our values of recognizing that diversity is a fact and inclusion is a set of practices so that we reach our outcomes of equity and belonging. The last piece that I want to just briefly speak to before we launch into an update on the fun that the Early Learning Council's home visiting committee's been having, and Peter, I'll be queuing you up to come right back to you, is the importance of mental models, right? We know that mental models are really our own mind's way of thinking about how things work. They're kind of our overarching ideas for concepts and frameworks and the worldview that we carry into any given situation. While they help us understand life, they can be imperfect, but they're still useful. And this is a big opportunity for ensuring that the system change that we are shepherding with the home visiting system responds to what we know not only children, but their families and our direct service home visitors need right now. You know, the best mental models are ideas that come with the most utility. They generalize from situation to situation. We want to use them broadly in our work. And we want to really leverage them to help make wiser choices and take better actions. So I want to pause because that was a lot of talking. And I just want to see if there's any thoughts that come to mind for council members on these 6 conditions of systems change before we head to a committee update.
Hi, Susan, and this is Ann Kubish from the Ford Family Foundation. It's nice to see you, and
nice
thank
to
you
see
for
you
working
again.
on this. Really so grateful for your work on this. I really appreciate that this talks a lot about relationships and connections, and I'm interested in your perception about that sort of that middle layer of relationships and connections and power dynamics, and how sort of the relative role that needs to play in this work going forward, given where we are in Oregon today, compared to the things that are at the top on the around policies, practices, and resource flows. And maybe that's part of the conversation that we'll get into over time, but I'm interested in how you're seeing that at this point.
Yeah, thanks, Anne. It's so nice to see you again, and what a joy it is to take on this work, but it's big shoes to fill after Christy having helped guide it over the last year. I would say that as we think about relationships and connections with home visiting systems change in our state, we need to be honest that a lot of tables are already set. And while we truly all, I believe, collectively value and are on our journeys and committed to equity, diversity, inclusion, and belonging, we need to slow down over the next couple of months and really dig into looking at what the tables are, who's currently around the table, and how do we bring in additional voices who represent diversity. And that might create some discomfort for people around the table. We all care so much, which causes us to want to hold things tight. But I think what we're hearing from partners at all of the different groups is that they're ready to embrace those honest conversations and broaden and make shifts as will benefit families in Oregon.
I really appreciate that. First of all, I appreciate this sense of this is not a clean slate by any means. There's a lot that's going on, and that's going to be the trick, is to bring all of that together. But I'm really pleased to hear you say that you hear a readiness for that, because that's what's going to be key to all of this work. So that's wonderful, and I'm glad that you're here to help lead that process going forward.
Thanks, Anne. Anyone else have thoughts or questions they'd offer before we move on to that committee update? Okay, if we'll move to that next slide, Remy, Peter, and on my screen, I can't quite tell if Peg's been able to join, but Peter, if you just lead off here with a recentering on who is a part of the Early Learning Council's Home Visiting Committee, and then we'll go into some updates from our recent meetings.
That sounds great. Yeah, just as a reminder, as we had that slide previously with the kind of constellation of the home visiting system, the home visiting system committee, myself and Peg, Brenda Kamini, Mary Geelan, Robin Hill Dunbar, Melissa Iserfin, Rick Ruzicka, Julie Seastream, Serena Stodmeyer, Tennille Weatherall, and Kate Wilcox make up the committee. And Peg and I are probably the least experienced members of the committee. Everybody else on the committee has been deeply involved in work around home visiting. So it's a great group for us to be able to have access to. If we go to the next slide, Remy. So what the committee has been very busy, and thanks greatly to the work Christy has done, but also everybody who's been involved with on every level, in every part of this constellation. People have been really focused on moving things along. Sue has been part of these discussions and really helped to keep focus on moving things along. So the completed responsibilities the committee has accomplished, we were able to evaluate the recommendations from the home visiting system working team. We finalized recommendations for adoption by the full Early Learning Council. Currently, we're focusing on developing and adopting a committee charter that maximizes partnering with the Home Visiting System Collaborative / Advisory Committee and Home Visiting Coordination Center at Portland State University. So again, this work that the slide Susan had there was looking at connections and partnerships and relationships. This is evolving in a way that's really strongly dependent on relationships and partnerships, and a good connection between the collaborative / advisory committee. The folks on the collaborative were willing to become the advisory committee. They want to clarify exactly what their role is. They have strong relationships with each other, and from all indications, they want to have a very strong relationship with the home visiting system committee as well as their learning council. And to have Beth and her colleagues at Portland State University as the coordination center has just been a great boost. The fact that everyone's been able to focus on that, and Beth has been fantastic in helping this come to reality. So with that, we can go to the next slide. Our current work continued. We want to continue to implement the home visiting system recommendations that the council adopted. We want to develop funding and policy proposals for consideration by the governor, legislature, and home visiting system partners. It's our job to regularly update the Learning Council, the progress we've made, and any barriers we've encountered. And it is our job also to advise the council on needed advocacy to enable the implementation of the home visiting system recommendations in alignment with Raise Up Oregon 2.0. So you go to the next slide, Remy. And this is the membership of the collaborative. You can see all the folks listed here. Again, these are folks that have been deeply engaged in the work of surrounding home visiting programs. They've got great relationships with each other. And I think we're really fortunate that they are willing to serve as our advisory committee. And they are passionate about their work, staying together to do their work to move the system forward. And with that, I think I'm passing over the next slide to Beth, perhaps. Oh, there's more. But wait,
There
more.
are more collaborative members. Thanks, Peter, for expertly guiding us through that. I want to pause just before I speak a little bit more about the collaborative. And council members, any questions, curiosities, compliments around what Peter shared around the home visiting system committee? Okay, well, now shifting, right? The Early Learning Council Home Visiting System Committee was one circle, and then over to the right, there was another circle, right? That's our Home Visiting System Collaborative. And I just want to take you back a little bit, a few years, and the collaborative formed as a group, again, for manager and supervisor level leaders, quite a few words there, for home visiting programs across Oregon. As you saw on the 2 previous slides, that's organizations such as Relief Nurseries and Family Support and Connections, Early Head Start, Nurse Family Partnerships, Cocoon, and McV, right? So as you think about those, again, there is a lot of agency backing for those programs. And I just want to plant that seed for you because we're going to talk about that in just a moment. What we're currently engaging in as a common thread team, and that's the name of our group, is that we are spending time with the amazing members of the collaborative. And we are spending that time in appreciative interviews. And so I want to bring the council into this journey of appreciative inquiry, which really has 5 key steps. The first thing is definition. What topic do we want to focus on together? And we know that right now, the existing collaborative has a lot of value. Its historical activities are something that those members want to retain. They want to see those continue to be available to their membership. And the collaborative has been tasked with taking on an advisory committee role for the new home visiting system, right? And really being a part of providing a diverse set of perspectives, voices, and real lived experience to guide our efforts towards system change. And so, there is this challenge, and what we're trying to define is and discover is what's the best of what is right now? What's the value that historically has come out of collaborative meetings? And what do they find exciting about the working team's recommendations? In our appreciative interviews, we then dig into what could be. And this is where all of those other partner entities, be that the Home Visiting System Coordination Center at PSU, the Early Learning Council Home Visiting System Committee, and then you as the Early Learning Council, thinking about those relationships starts to emerge from the interviews. And then what you almost see very naturally without our even prompting is collaborative committee members start to move into designing, which is thinking about what could be, what should be, and then creating ideas for how we will move in that direction. And so, again, much appreciation to Heidi Groger, who's serving as our chair. Our goal is to spend the next 2 months conducting a second round of appreciative interviews that will pull in the home visiting committee's working team members. We believe they have additional insights to add to the collaborative members that have already been interviewed, as well as direct home visiting service providers and families, parental voices, caregiver voices that have been recent recipients of home visiting services. With that, we will truly be living our values and moving forward in ways, and back to what you said, of taking this table that has been set, that is making progress, but diversifying the voices, the perspectives, and the wisdom at those tables. So I want to share with you in the next couple of slides some of those design and destiny components, the ideas that have come forward from the existing collaborative members who have already taken part in appreciative interviews. So Remy, if we go to that next slide, what you're going to start to see are ideas generated from these home visiting program leaders that have so much alignment with not only Raise Up Oregon 2.0, but also with the working team's recommendations. These then can be viewed as strategies to help accomplish the objectives and goals of both Raise Up Oregon and the recommendations. So you see everything from focusing in on their membership, which has come up from every collaborative member that we've interviewed, thinking about their leadership model, formally adopting an equity lens, by first going through an equity assessment of their own values in the group as a whole. And then thinking about more pragmatic things, like how do we build and enhance on the maps that are already in existence around home visiting partners and programs. Remy, let's look at a few more ideas on the next slide, friend. So the next slide, we're going to think about potentially hosting some innovation cafes. Collaborative members really wanted to think about how do we create community? How do we generate excitement and ideas across programs, across geographies, across cultural representation groups? And an innovation cafe has been a really great proven model here in our state. They want to talk about workforce development needs, and I know that that is talked about here at the council and very much addressed in the recommendations of the working team. And they definitely, this last one, establish a process for communicating up. How do we continue to have virtuous feedback loops from communities that don't ask unreasonable amounts from those communities? The burden of ease of accessing and sharing reflections and ideas really needs to be on us as systems partners to ensure that they're viable for everyone working on a direct home visiting level, as well as parents to bring forward their wisdom. And Remy, that next slide is our last one on ideas from the collaborative. They want to learn. You'll see study session, study session, study session, right? How do we engage parent and caregiver voice? What are those successful efforts that have already been completed? And what are those bodies of data that we can learn from? How do we engage direct service providers? And there is a lot of talk about information technology with the goal of enhancing collaboration on behalf of families. And there we just end truly with and so much more to come. The final slide about the collaborative, before Beth, I'll hand it over to you for a home visiting coordination center update, is here are the next steps of the collaborative, right? We're going to do a second round of appreciative interviews, recognizing that a pause to do those and to release a survey in multiple languages for direct service providers, as well as parents and caregivers, and to fold in additional working team members who have not traditionally been a part of the collaborative, is going to lead us down the road of living our values of equity and inclusion. And again, those individuals will be people who perhaps might self-select to want to be a part of the collaborative moving forward. We are aiming to hold an in-person meeting in August so that then we can look at what's been gleaned from the appreciative interviews. And from those interviews, the Common Thread team will have drafted a charter for the collaborative. That charter, one of the tasks that we have at Common Thread is to ensure that there are crosswalks and connections to the Early Learning Council's Home Visiting System Committee charter that we'll be developing, right? Again, going back to relationships, connections, and power dynamics. And then they want to get to work. We keep hearing that over and over. We're going to develop a work plan. We're going to resource and come back to you and let you know what barriers might be in the way or what resources might be needed to help move things forward. The collaborative will live into its new role as an advisory committee for the Home Visiting System Committee and partner with Beth's team at PSU on this development of the Home Visiting System Coordination Center. And again, they're just very open and excited to being a part of this worthwhile endeavor. So before we hand it over to Beth for Coordination Center, I just again like to open the floor. Questions or comments about progress of the amazing collaborative? Subin.
Hi, I have a comment that might have a question in it. So, I've observed and have witnessed and read about appreciative inquiry approaches in the past and have seen it be very powerful. I think that a lot of the participants who kind of go through well-facilitated appreciative inquiry, they find power that they didn't know that they necessarily had. And they find comfort in the group, right? In kind of being together. And one of the kind of, potential, kind of roadblocks that I've seen come up is that shift between the dream and the destiny phase, where, we're something has been dreamed up, things have been tried, and we're learning from them. And there isn't always a clear process in terms of reflecting on what is being done, if that makes sense. That sometimes the ideas, we might need to adapt or change or let go of some of the ideas. And so I wonder about that and where that kind of shows up in the process, because that usually is what kind of blows up the timeline and makes things, longer than expected.
Absolutely. And Beth, I see your hand came up, friend. Would you like to go ahead and then I maybe can add some ideas at the end?
Go ahead, Susan, then I'll chime in.
Zubin, first, thank you for raising that up. We end every appreciative interview by doing pluses and deltas. Pluses being ahas or something that took place during the gathering that gave you energy that you're excited about, and deltas being requests for process changes or things that are kind of lingering that we still need to work on. And that sense of empowerment, the appreciation for an open space where it's safe to share ideas and truly dream, comes up time and time again. And the details are where we get stuck, right? And we can get stuck in the messy middle from deciding that a change is what we're going to engage in and the transition through that change process. And so I don't have a clean answer for you in this moment, but what we're hoping is that through engagement of additional stakeholders, through making sure that all the respected planets that are orbiting in this home visiting solar system, that they know about each other, that we can get down into some concrete tools for organizing what could be done, prioritizing what's viable. And a lot of that will come through crosswalking, the ideas of the collaborative, the ideas from Beth's and her insights from Beth's team, as well as Raise Up Oregon and then the working team recommendations. And I would say that we're going to write that in as an explicit value into charters of a quality assurance, performance improvement, like a monitoring process that we will use to make sure we are moving forward. So thanks for that important question, Zubin. Over to you, Beth.
Thank you. I would just add to that. I mean, I see our team, and I'll have a minute to talk a little bit more about the coordination center and what we've been thinking about. But part of what I see as an important role of the coordination center is to really reflect the model of shared learning that we've been using in our Southwest Oregon home visiting systems work, which is to really come alongside the systems partners who are doing the dreaming and putting a vision in place for the system and helping to intentionally build in feedback loops and opportunities for learning so that you are not losing momentum and you are keeping your eyes on the vision, but also being able to adapt based on what you're learning along the way. So I see that as a really important function of the coordination center.
Thanks so much, Beth. Katie, I see your hand, friend.
Hi, I was wondering, what metrics are you going to use as you track success along the way? What does that actually look like?
Yeah, Katie, can you
Let me, Susan,
go ahead. Yeah,
let
go
me
ahead.
interrupt. I'm worried that we need to get Beth in this conversation. So Katie, if you don't mind, because I think Beth is going to have some answers to that question as well.
Right, I can wait.
So, okay, thank you. Let's move to Beth and hear about the coordination center, because ultimately that's going to be where the the coordination happens, that's where the action's going to happen long-term wise. So Beth, maybe you could step in now and then we'll go back to Katie's question.
Yeah. Do you want to just move us to the next slide there? Okay. So thank you. I'm Beth Green, Director of Early Childhood and Family Support Research at Portland State, and I've been at the council meeting before. So just I want to bring a little bit of update around where we're thinking in terms of the coordination center. The idea that was the idea that was brought to me and the request was for a coordination center that would house 2 full-time state and a statewide and a regional coordinator. So to do some of the work, I think, of advancing this vision, right? So all of the things that Susan laid out that came out of that collaborative, as well as the ongoing conversations across the different tables where folks are talking about home visiting systems and how to make them work better for families, to advance that work, right? Because that's a lot of work to do that coordination. So to house those 2 coordinators, as well as to house the evaluation team here that's brought a lot of knowledge and experience based on our prior work in early childhood and sitting across a lot of different program partners, home visiting models, and especially the work that we've been doing ongoing for the last 8 years with the Ford Family Foundation around building home visiting systems in Southwestern Oregon. And that's sort of the learning piece. And so part of the work, Katie, to your question, is also to identify with the collaborative, with the council, with the committee, what are the appropriate metrics? How will we advance change? We have a number of data points that we've been collecting ongoing in Southwest Oregon that we would bring to the table around functioning collaboratives and home visiting systems improvements. So I think for this work, we would start with those. So we're building on what we already know, but then continue to ask the question, like, what are the right metrics for this sort of state level work, regional level work, et cetera. So our focus areas here, I think, let's see, a lot of this just reflects what Susan has already talked about. I think some of our guiding principles really align with the work that Susan is supporting through the collaborative. And again, we're just bringing, I think, the person power to continue the process and make the work happen. If you want to go to the next slide. I don't know who's got. Next slide, please. Thank you. All right, so we put together a draft scope of work. It's also, just want to say this is still very emergent. We are working with a variety of folks to get input, the Home Visiting Systems Planning Committee, as well as the Home Visiting System Committee. There's many committees. So some of our key ideas or pieces of work that we hope to do are to, again, really advance and create tables that broaden the current partners. So that's a really important piece to us. And that's a reflection based on the equity lens that we've been using in our work to really center family voice and the experiences of families with lived experience, as well as to expand the home visiting tables to really intentionally go beyond sort of the traditional partners that are embedded within our state agency systems. To really bring knowledge and surface continued points of connection as well as barriers and continue to bring those up and to start to map them and prioritize the work around things like governance, workforce, pay equity, data systems, et cetera. We will support the work of the collaborative, or we will do the work of the collaborative. We will support the vision of the collaborative in doing that. And again, collecting ongoing data and analyzing it and creating those opportunities for reflection along the way. Next slide. Is that it? Maybe that's it. So those are our buckets of work. The specific activities are in the draft scope of work. We're still working on sort of deliverables and timelines, what's reasonable to expect in the first couple of years. There's a lot of sort of foundational work to map the landscape. to begin to bring the knowledge that we've developed through the work with Ford Family Foundation to the table, and again to do some of that intentional outreach and building of bigger tables so that we can make sure that we don't create a home visiting system that, to be frank, a bunch of white dominant agency system partners are saying are what family needs, but what families are actually needing. So that's the goal, that's the vision. And our team is very excited to be working with Susan and Common Thread and all the other folks who are, I think, really ready and motivated to do this work. So I will stop and leave questions.
Okay, so are there questions of Beth about the coordination center? Obviously, this is going to be the real key to rolling this out over the next several years and biennia, really. This is a long-term project. We all know it's not going to happen in year one. Beth keeps reminding us of that. But the coordination center is building on such a great foundation of research and work that we're lucky to be able to just, I guess, in a way, leverage that or tag on to that. So questions of Beth, and I want to acknowledge that Dr. Irvin Brown from ODHS is on the call, and he's a part of our planning team for this initiative representing ODHS. And Serena, whom we all know, is on the call as well, and she's a member of the Home Visiting System Planning Committee, along with Peter and Peg and others. Hi, Serena. Good to see you. So I just wanted to acknowledge them, and feel free to join into this conversation as very key partners in this.
Sue, can I ask a question of Beth? Because Beth, you've been so involved in this work in Southwest Oregon, and a lot of it has really been with the partners, with the home visiting systems partners who are local. Now what we're trying to do is to think about bringing state level agencies and leaders and systems together. And that's a whole new level of challenge. And I'm wondering how you're thinking about those kinds of, because it's not directly transferable. I mean, some of the things that we've been doing in Southwest Oregon are transferable, but working at the state level brings in a whole new level of system actors that we haven't done, which is exactly why we're doing this. That's what's so exciting about this. But I'm wondering how you're thinking about the sort of the coordination role of working at so many different levels.
So I think, thanks, Anne, that's a great question. One of the other things that I think that our team is bringing, in addition to the experience in Southwest Oregon, is I personally have 30 years of being an active participant and a lot of different state level conversations about home visiting systems. And Kate and I have a bit of a shared, Kate Wilcox and I have some shared history and shared, I won't say trauma, but shared consternation of the various cycles of activity that have happened at the state level. So I think, not to say that we have it figured out, that's why I keep saying, for me, one of the foundational expectations when I was approached about this work was, who are we going to be working with, right? Because these coordinators housed at PSU will not have the power to change things at the state level. They will have to be bringing information and facilitating relationships among those folks who do have decision-making power. So to the extent that we have those folks at the table committed to the vision, right, that will be sort of the first foundational piece. And I think there's a lot of work already in place there, but to build that, to extend the table, and then really keep people focused on that state level vision and commitment from state level leadership, that's going to be a key driver. So if we don't have that state level buy-in cross systems, I think that's going to be problematic. But it seems like it's there. I'm cautiously optimistic given what I've been participating in so far.
I appreciate your point about the history that both you and Kate have in this, and I think you clearly come in eyes wide open. So That's really great that we have the leadership that we have on this. So great.
Well, and I want to mention, obviously, as we talk about contracting with Susan and Common Thread, as well as with PSU for the longer term, and where our 2 employees will be embedded, or they'll be PSU employees, but doing our work. So obviously funding is an issue. And as Susan mentioned earlier, it's on the planning team is where the funders sit. So it's a very important group of people. It obviously has representatives from DELC and from OHA and from ODHS with Dr. Brown, and then also from philanthropy with Robin sitting on it for the Ford Family Foundation. And Gabby also is on from OCF. So that's, I think, where we will see some of the, sort of the accountability, I guess, and hopefully these people are going to be the ones who are going to be moving the changes forward as, and how, making the recommendations happen, implementing them. And it's very exciting that thanks to Kate Wilcox and also Pamela Ferguson, it appears that there's going to be McVie funding to cover much of this contract, about 75% of the contract with PSU. So, that took a lot of talking to their federal administrator, and she's been convinced that this is going to be what really helps build a home visiting system in the state of Oregon. So that's a huge step forward, and we still have to do the other 25% with our partners, but I'm confident that between DELC, ODHS, and thank you, and the Ford Family Foundation, we will get there. So lots of good things happening. And as I think everyone on the call has mentioned, it's people want this to happen, from Susan and the collaborative work, and Beth and PSU and Peter and Peg and the committee. Everybody is in this. It's sort of, there's nobody sitting on the sidelines saying, I don't know. So anyway, I know we need to wrap up pretty soon. Are there other questions that people have of Susan or Beth or Peter? And then we can see, Susan, if you've got final wrap-up comments that you'd like to make. Okay.
Well, my only final wrap-up comment is that I am here. Obviously, you all have relationships with Sue and with Peter and Peg and the agencies. Here is how you can reach me. Again, Sue, I will send that follow-up email to you. Love the idea of, for those of you with resources or tools that you think could help the work moving forward, our team at Common Thread would welcome you to share those with us. We're so grateful to have the opportunity to be a part of this effort, and we're always here to receive feedback about how we can be living with integrity, with the intention and the goal of helping move this work forward in the ways that Oregon's families and home visitors need. So with that, I think we wrapped this up just even a few minutes early.
Okay, Susan, thank you for keeping this momentum going, as we say, because there was a lot of momentum, and we do need to acknowledge what Christy Cox did to get us to this point. If you followed what Christy did for her 9 months with us, she was quite an engine, shall we say. Yeah, incredible.
Thank you for your team womanship on this, Sue. Appreciate you so much.
Oh, it's fun. very fun. Peter told me I'd enjoy working with you, Susan, and Peter, you were right. Definitely exciting. So council, as we've said before, Peter and Peg and the committee with Susan's help will keep us updated on what's happening with this initiative. And we will keep you updated also through emails and other communication, I'm sure. Peter, any last thoughts from you as the co-chair?
No, just thanks to everybody involved.
Thank you,
Okay,
Peter. Pleasure to be here.
yeah, this is going to be exciting. And thanks Susan and Beth. So, all right. We will get ready then to move on, council. As you know, we have invited our agency partners to join us again. They were served on a sabbatical from council, but certainly not a sabbatical from the legislative process for the last 6 months almost. So I think many of them are coming up for air slowly. But we've invited them to join us, and we're really going to shift our focus now to Raise Up Oregon. And when I've talked with the agency directors in the last couple of days, I've asked them if they would, try to focus comments on Raise Up Oregon and where their agency is really involved in the implementation, and specifically where their agencies are either currently partnering with or hoping to partner with other agencies to implement the strategies and actions in the plan. And council, if you've studied the plan over the last several months, you know that there are, dozens and dozens of actions in here that the agency managers and leaders have put in the plan through RUI Act. So these are commitments that are very exciting to see, because that's what's going to make the plan real, for sure. And later, after we have this conversation with our agency partners, we have on the agenda adoption of this plan. So this will be the time to make sure that we've got in the plan what you want, what you think we need to have to build an early learning system, early childhood system in Oregon. And we'll wait a few minutes. Why don't we take a 5-minute break while we give the other agency partners a chance to join us. All right, let's go ahead and reconvene, council. And I'd like to welcome our partners from our partner agencies who have joined us on this call for a conversation focused on Raise Up Oregon, which is a very exciting document that we've been working on for about a year now, with lots of input from our agency partners and the staff that you allow to participate and lead the implementation team. So thank you for that staff involvement. As we all know, and when I talked to the agency directors in the last couple of days, we're going to focus this conversation on what they see as the parts of Raise Up Oregon that are inherent to the work they're doing in their agencies, and also where they see the cross-sector work really to their advantage to implement the strategies and actions that are in this plan. So I thought we'd lead off with Dave Badden, who's the acting director of OHA. And Dave, if you would provide some comments. And council, I thought what we'd do is hear from each of our agency partners, and then let's just open it up for a conversation. So we'll have plenty of time for that, I think. So welcome, Dave, and thanks for being here.
Yeah, thanks, Sue. Thanks, everyone. Greetings. Again, Dave Badden. I use he, him pronouns as the interim director of the Health Authority. Yeah, I have appreciated the conversation, Sue, with you and some of the OHA staff who have been working hard and thinking about lots of different areas. I mean, I think the pieces and maybe the challenge of trying to figure out a couple of things, I think, from the OHA side, which is where, I mean, we all do our work and need to do our work in sort of an interagency way and assure that we're sort of connecting across. But also we need to do a better job within these big agencies like OHA to connect across our own silos to do work. And so trying to reflect a little bit on where I feel like that it's, at least that's happening in many of these areas. I hesitate to use the word always happening well, but at least it's happening, to try to bring some pieces together in doing that. And so then trying to think of where are there spots where the Early Learning Council and other, could be helpful, this, sort of this document to maybe help add some emphasis to that coordination in a couple of areas here. So maybe I'll just highlight a couple of and maybe not call out specific strategies, but maybe group some things together in doing that. I do think where there can be from the early learning hubs and other spots, where this sort of person-centric and I guess in this case sort of kid and family centric look of connections could happen better than they're happening now. And I could think of a lot of different examples to where that there's lots of new unique things that are happening in Oregon around the implementation of the 1115 waiver with continuous eligibility of kids up to 6, expansion of the Healthier Oregon program, which starts here next week, which will open up Medicaid-like eligibility for anyone that meet income requirements regardless of immigration status. That's another 40,000 people that we will move into Medicaid, Medicaid-like OHP services here on July 1st. But there's like other just all the connection points that I think could happen for whether they show up at a someone comes to an event sponsored by pick your agency. How are we better connecting those spots so that if someone like even within the agency, I used an example of we're continuing to do some COVID vaccine and COVID testing events, especially in spots where regardless of insurance coverage, to be able to have people at least get access to continue COVID vaccine and COVID testing where needed. There was a lot of work through the pandemic where like people would come in and a lot of work with community-based organizations to make those connections. Well, now we have the nice added hook of people would be able to get signed up for the Healthy Oregon program at that same time. But if we don't make those right connections, one group will be focused on COVID vaccine out of the public health division, and another group may not actually make that connection to that group because they're not managing Medicaid. So how do we are those sort of spots to make those connection points? So I think in sort of 1115 waiver implementation, there's a lot of spots there where inherently, like we've got to do, make those connections. I will admit it's going to take some time to build sort of the right policy and the right sort of organizing principle around how the housing benefit is going to be rolled out. So I think there's some there on waiver implementation for sure that could be helpful. I think, where the early learning hubs could play a role in there are potentially some resources that will be available in infrastructure funding to help make some connections. But honestly, like, do the early learning hubs want to get in that sort of game? I think there's a little differences, it sounds like, across the state. So I think that's one piece there. The other pieces that I think are important in the strategy document. There's some spots that I feel that sort of the need for community engagement, especially engaging communities of color across the state in figuring different family and community engagement. Strategy 2.7 talks about this. Strategy sort of 10.3 about co-creation of policies. So I will say that we are engaging within OHA a better coordinated work around community engagement than we sort of coming out of the pandemic, where we built a lot of new capacity and community-based organizations directly. But we've got to make sure that we're not making 17 phone calls to the same CBO. And that's maybe 17 just within OHA. I'm sure Alyssa or Liesl or other of my colleagues on here would be talking to many of the same CBOs because they get involved in a lot of other areas, not just around OHA, but clearly sort of other social services or early learning child ed programs that would hit all of us. So I do think that there could be some there on how how the state is sort of better coordinating those pieces there, especially when it comes to kiddos and families in there. Lots of other strategies speak to OHA, could talk about lots of other connections, but maybe I'll sort of stop there. I think the home visiting stuff and sort of connection there, I think, is important. But yeah, anyway, I think those were sort of some of our thoughts generally.
Awesome. Thank you, Dave. Great overview and synopsis. Liesl, how about ODHS?
Sure. Good morning, everyone. Liesl Lent. I'm the Deputy Director for ODHS, and I use she, her pronouns. Yes, maybe I'll pick up where Dave left off. Some of us were at a Racial Justice Council meeting a couple Fridays ago, and clearly the theme from community-based organizations, culturally specific, and otherwise is, hey, can government get organized? Because we ramp up, we ramp down for OHA, for ELD and OHCS, or insert the other agency, and they're worn out and they can't compete with wages for our staff. So I do think a concerted aligned strategy towards supporting CBOs is a really important piece. Like, the plan identifies narrow pieces, and I think that's what CBOs were pointing out. You as government function in your silos. We do not. We function for families and community. So I'd love to see maybe a specific strategy about how do we take the parts and pieces of the plan and what gets invested in CBOs versus state government, and how do we have a conversation with CBOs about how they'd like to do and see and be part of implementation. So if I were to add one big thing, that would be it. And I think our tribal partners would have similar feedback. And so I think that joint conversation or some conversation there should be a priority. And I'll add that many CBOs lost one-time funding through the pandemic, so are struggling right now. And so I think we all have some joint work to do to figure out how to support them. I think a couple other things I would highlight. We tend to look at whole families, and a lot of this plan is early childhood. And so my plug will also be just making sure we're not creating separate plans or systems for 0 to 5, 0 to 6, but we're really making sure we're creating systems for families and then figuring out which dollars pay for which populations. That's kind of some bureaucratic, on the back end, what does that look like? But just wanted to flag that. Something I think I'm really excited about, and Dave hit on this too with the hubs. One of our strategies in the agency is pushing resources and accountability to our local leaders. We have 16 districts across the state that implement and manage self-sufficiency and child welfare programs. Oregon eligibility program in this last legislative session is now its new appropriation, which for general speak means it's its own program now. So we'll be creating an eligibility team that those district managers will have a part of. And what we've seen as we focus on community supports and implementing our Equity North Star is that the solutions in Oregon have to be community driven. What works in Medford or Grants Pass may not be the same that works in Burns. And so we're saying to our district managers, borrowing some early learning hub language, here's some tight things, here's some things we need you all to do. And then here's some loose things. What is your community's focus, whether it's early learning, housing, healthcare access, and how can our district managers become human service leaders, not just administrators of programs? So that's a big shift for us. We're hiring different leaders with a different position description. We're empowering them. Turns out our own central office gets in the way of them doing that. So we're taking a hard look at how we're organized and how we're getting in the way of whether it's contracts and procurement or hiring or budget or what have you. So that's kind of an inside out flip that we're working on during this next biennium. It'll take us probably 2 years. And our goal is to head into the next session with a proposal to legislators about how do you support local service delivery differently. So I see that's kind of bureaucratic speak, I realize, so pardon me, but I think that's a huge opportunity about how do we empower local leaders from a DHS perspective. A lot of that's in this plan. And so how can we work together across agencies? Because I think our leaders can lead too, right? I think they can lead with CCOs. I think they can lead with early learning hubs. And what if that triumvirate, we collectively support it and said, hey, you three, we want you to have these goals in your community, and we're going to get out of your way and really empower you to make that happen in your local communities. I realize that's a big vision, but I would love to see us collectively giving direction to our leaders so that they can do the work at the local level. Another piece I'll just flag, we have funded Echo Northwest to take a look at what are the best practices, emerging practices around economic security for families. Some of you may have, we've been doing quite a bit of community engagement to get feedback on some of the suggestions. Obviously, things like baby bonds, universal basic income are surfacing in that conversation. So it's not that we may put those forward in our agency request budget. We really said to Eco Northwest, tell us what the emerging practice is. We'll share it with partners, other agencies, other community-based organizations and legislators to see where Oregon might want to go and really supporting the economic viability of families so they can do all the things for their kiddos. So just wanted to offer that. And I think the last thing I'd say is really interested in the how. I think Dave and I learned through the pandemic that when we are joined at the hip as agencies with joint leadership, clear plans, clear timelines and deliverables, we do amazing work. And we tend to, in Oregon, to do a lot of big passive plans and talk about them. And so whatever we can do to make a strong structure to really set some targets, you know, we're all in on, we'll put our resources there and lean in with all of you, but love to see a little bit more structure and urgency around timelines and deliverables. So I'll leave it there.
Thanks, Liesl. Very exciting. I'm sure the council's going to be excited to dive into this, and this whole community engagement and local regional focus is certainly sort of across the board. Alyssa, how about your new agency?
Sure.
Almost.
Yes. If it's all right, Sue, as we kind of dive into this, I'll just very quickly flash up a couple of slides because, as you mentioned, we're going to be a new agency in 3 days. And so wanted to just acknowledge that we are 3 days away. And we have been doing a lot of work. And so we're happy to send these slides, but just wanted to make sure, especially since this was a part of the first iteration of Raise Up Oregon, that there would be, a consolidated and unified early learning and care agency, that you're aware of kind of everything that's going on. And so we have new mission, vision, and values that were developed with childcare providers, families, community partners, and staff who've done this work, for years, to really be intentional about who we are going to be and what we're going to work towards. We have really been focusing our priorities on delivering comprehensive services, including getting early learning and care program funding out the door, and improving the administration of licensing, supporting and strengthening our workforce, and continuously improving and creating system efficiencies. So as you know, everything that's in the early learning division is coming to DELC, but we also have some key functions related to the employment-related daycare program that are moving over. We have some resources we'll be distributing around and have been distributing around what to expect. So a lot is staying the same to minimize disruption, but there are some changes like a new website. We'll have a new grants management system, and just thinking about what this work looks like in the coming years and recognizing that this is a major milestone, but the work doesn't stop. And I think as I talk a little bit about Raise Up Oregon 2.0, that's just super evident, and wanted to make sure, especially recognizing that folks are tuning into these meetings, that there are some really exciting eligibility changes that'll be happening with the ERDC program, allowing TANF families to access ERDC at the same time, and reducing the number of reasons that a family may be removed from the employment-related daycare program. So I wanted to just start with those pieces. A lot of exciting work, happy to share these slides, but recognizing that this would not have happened without the council very clearly setting that intention in the first iteration of Raise Up Oregon. I think similar to what Dave and Liesl have shared, there's a lot of work ahead on coordination, collaboration. I think obviously we have a lot to do just associated with operationalizing this new agency. But I think there are some strategies that really stand out, recognizing that a lot of this Raise Up Oregon plan includes a lot of work that really fits into, our goals, objectives. I think it's so comprehensive and thorough, and it's going to give us a really strong start for us to be able to develop our first agency strategic plan. But I'll just name a couple of strategies that really stand out to me. 1.1, and really following through on the tribal hub that was developed, that's been created as the Oregon Tribal Early Learning Alliance, and creating that intentional government to government relationship with the 9 federally recognized tribes in Oregon. Of course, with the governor's kind of priorities in mind, working with ODE on early literacy development standards, expanding the availability of care in 14.1, including the workforce, facilities, and transportation. We were so excited to see House Bill 3005 pass with 50 million in lottery bond dollars to implement the Child Care Infrastructure Fund. 14.2 and making sure we see increases in state support and investment in the sector. 14.6 and continuing to refine and improve our childcare licensing and compliance work and ensuring that it's rooted in equity. 14.8 and preventing suspension and expulsion. And I know we've had a lot of updates with you, but that really has to be a focus for us as we think about the ban in 26. And 16.1, again, with the governor's kind of early literacy goals in mind, making sure we're updating that early learning and kindergarten guidelines with the Department of Education. So just wanted to name a few. Again, there's so much in here that we're really excited to tackle and really be able to build off of for our own agency strategic plan, and just want to appreciate the work everybody's done. I think we know that the first iteration of Raise Up Oregon was a success and we made significant progress. It didn't sit on a shelf. We actually did the work, but I think this next iteration goes so much further, and I'm really excited to see what we're able to do together. So thank you for a little bit of the time, Sue. Oh, you're muted, Sue.
Thanks, Alyssa. Exciting progress moving forward. Okay, so I want to welcome Ramona Rodemaker to our meeting. She is going to talk about HEC, which we all know is a very critical and our newest partner. Ben Cannon is out, probably taking a well-deserved and needed vacation, I hope. And Ramona, thank you so much for joining us today and giving us some feedback on the plan from your perspective.
Great, thank you. Good morning. My name is Ramona Rodemaker. I'm the Deputy Director of Higher Education Coordinating Commission. Ben wanted to be here, but apparently his wife had other plans. So I'm pleased to be able to talk about a couple of opportunities that I see for connection. I know Ben mentioned in previous meetings that one of the goals for the legislative session was for us to get some investment into early learning grants. While we were able to actually improve the law and include early childhood behavior and mental health in the definition of what could be funded, we did not actually receive any funding to be able to make those grants. And so I just wanted to close the loop on that previous discussion so that people were aware of it. I do think, having looked over Raise Up Oregon, there are some other some opportunities that are really ripe for exploration between this council and HEC. In 2021, we received about a $200 million investment in what was called Future Ready Oregon. That was basically to pay for some education and training for family wage careers. And it's particularly focused on creating opportunities for historically underserved individuals and communities in three sectors: manufacturing, technology, and healthcare. That healthcare sector, I think, really provides some overlaps between Raise Up Oregon and what HEC is working on. So we're trying to engage diverse partners, community-based organizations, and others to really shape this process in what's a new initiative and program for us. There are 9 strategies in Future Ready Oregon. 2 of them are, I think, probably of the most interest to this group. The first one is an industry consortia strategy. And what that is we are trying to, in those 3 industries that I mentioned a minute ago, trying to establish strategic partnerships, develop structured processes to address mutual industry goals, identify industry-specific workforce needs, and develop targeted recruitment strategies to increase participation and promote workforce development programs in targeted industry sections. And so I think the overlap in strategy 2.8 is really where this industry consortia strategy comes to play. I think that we have just convened our industry consortia and are getting those partners together to identify their goals and what it is they're focusing on. And I think it makes a lot of sense to fold in the goals that you've already developed in terms of, linking the healthcare needs of young children into this. And so what Sue and I discussed yesterday was an opportunity for probably somebody from this group or to participate in the industry consortia, but also potentially for the manager of that effort to participate in the RUYACT, sorry, new acronym for me, and the agency implementation coordination team for Raise Up Oregon. And I talked to the director of Future Ready Oregon, and she is excited about that opportunity and is definitely on board for discussing how that might work. The other strategy in Future Ready Oregon that I think is worthy of some exploration is we received in that $200 million for Future Ready, $95 million for workforce ready grants. We just closed this week the second round of that, but there's still about $50 million out there that community-based organizations and other service providers can apply for in future rounds. And the goals for that money are to provide paid work experience, including stipends and wages, tuition and fee assistance for workforce programs. So if there was a community-based organization that wanted to explore how to get more people into the field, that seems like a real good opportunity. But it's also for wraparound workforce development and support services and development of culturally and linguistically specific career pathways for obtaining certificates or credentials that are recognized by the industries, and then also just funding of organizational investments. And so it makes sense, I think, for us to think more deliberately about what the intersections are between the goals for this program and get the word out, I guess, for the most part, about opportunities. If people are trying to develop new strategies, we'd certainly be interested in potentially, it is a competitive funding opportunity, but we'd love to see applications in this field. And so those seemed like some of the obvious connections to us. Hearing Alyssa talk about the early learning, I guess I'll also mention that we've been asked to staff the governor's early learning group that is being put together. And so we will be very involved in that as well. And literacy, early literacy, too many L words. And so we're going to be staffing the early literacy group that is mentioned in the governor's executive order. So those are some of the more obvious opportunities, I think, where we can support Raise Up Oregon.
Wow. Very exciting, Ramona. I mean, all sorts of those are ringing bells for us on the council. We've talked about workforce at virtually every meeting we've had in the last year or so. And thank you for the potential connection to RUYACT. And you did say that exactly right, but partnerships are the key, and everyone is agreeing to that. Colt, as you can imagine, today is rather busy. He thought he could join us about 10:45. So we'll see if he gets on and can talk about ODE a little bit. The whole housing and community services, they are in an all-day retreat, trying to, I think, grapple with what the legislature gave them. So I asked David Mandel if he would just do a really quick update for us on sort of the housing piece of Raise Up.
Well, I won't give an update on the housing piece, but what I will give an update is on the co-location fund. So this was the legislature previous session had allocated 10 million for co-location of early learning facilities in affordable housing developments. This is actually a strategy identified in Raise Up Oregon, but also I think just a great opportunity to really think about some of that integration of supports in a way that really work for families. I think there's a really sort of intuitive and natural linkage to think about what are those advantages about having early learning facilities right there in affordable housing developments. However, there really has not been resources to support that work in the past. As first phase in moving this work forward, Oregon Housing Community Services, and we were involved in this, put out an RFP for organization to really manage the fund, and we received a really great application from a coalition of community development fund institutions, and that contract, I think, was just signed last week. So it's a really important step in moving that forward. The initiative is being referred to as Build Early. And I think one of the great things about the group of organizations that came forward to really administer and lead this work is they're also really bringing together that real marriage of knowledge and focus, both on the affordable housing side of the work and on the early learning side of the work. And the way the fund will be set up will include both actual dollars to support development, but also supports and technical assistance, both on the early learning side, on the affordable housing development side, and also work to help bring those developers and those early learning folks together. So really exciting work.
David, can you tell us who's in that consortium?
I do not have the full list in front of me, so I don't want to miss out on anyone, but I will send a link with information to the council.
Okay, thanks. That'd be great. I heard the list last night, but I think there are 4 or 5 that have come into that consortium.
Yeah, and really just a great mix of experience of working in different parts of the states with communities, but also bringing, again, both that affordable housing and that knowledge of, what does it take to actually put together an early learning facility.
Right, and real connections to the private sector, which obviously are going to be really critical in this. So thanks for sending that out. I know council members will be really interested in that, and will recognize, I think, many of the partners. So let's open it up. And I know that another hot topic, and certainly a topic of interest for all of us with our agency partners, is sort of, so how'd they do in the legislative session that just ended? Were there wins? Were there losses? Obviously, the council weighed in on some of the bills, trying to support our partners. And so I think Liesl has put some information together for ODHS, but I'm guessing others of you may want to just provide a quick update on how you did where you ended up. So Lisa or Dr. Brown, does one of you want to provide an ODHS overview?
Sue, I can give a quick update if Remy, I think, has the slides and can just pull them up, and we can send them out later as well. I think some that you might be particularly interested in the early childhood spaces. We did receive additional positions for child safety within our child welfare program. So this will mean that staff have more reasonable caseloads. So very excited about that. We asked for more, but we'll take 50 staff. Another really exciting / overdue one is an increase in resource parent, formerly we called them foster parent reimbursement rates. So those rates had not been increased since 2018. I think we can all appreciate that the cost of living, especially for kiddos, taking care of them has gone up. So that's another exciting one. Rates in addition to workforce were a big focus of conversation this session for us. And there was an increase in BRS, which is the Behavioral Residential Services. So this is an increase across ODHS, OYA, and OHA. So that was a $22 million investment there. We've heard that actually was a later ask in session based on a rate study, and heard loud and clear from providers. They just can't keep staff at the former rate. So big excitement there. Dave talked about Healthier Oregon program, or HOP, and this is the program that formerly called Cover All People and allows for OHP access regardless of immigration status. And there were some previous limitations on ages, and the additional funding will allow for older adults and people with disabilities to be covered. So be looking for some outreach and promotion to make sure we're reaching people who may now be eligible for that particular program. Let's see, we've talked a lot here about the Oregon Eligibility Partnership, or OEP. Alyssa has been a really strong partner in the last 1.5 to 2 years as we seek to manage the transition to DELC and make sure that OEP is providing services to folks. So several asks there. One, as Dave mentioned, the Medicaid waiver. We added some positions to make sure that we can make the technical changes and be sure we can provide eligibility to new people who might be reaching out for services. And, more around Healthier Oregon program, making sure we can, again, make the technical changes to the data system to accommodate that. And then another piece that was part of the early session housing bill was expanding the youth experiencing homelessness program. That is run through our self-sufficiency program team. So we were already providing shelter services, direct outreach to different CBOs who are providing the direct services. So we're able to expand that in the next biennium, which of course I think we're all pretty excited about. So just a couple highlights. And again, we'll send the slide deck so you have the numbers and the FD and all the particulars.
Awesome. Thank you, Lisa. And Remy will send the slides out to us. So we've got that, but appreciate the update. Any legislative updates from others of you?
Sue, I'm happy to add a couple of other pieces. Yeah, thanks, Lisa, for highlighting, I think some of the health coverage pieces, I think, although we didn't have a lot of policy bill changes per se around health coverage, it really was a budget sort of focused session on things that may have been thought about and started over the last year or so to assure that there's funding available. So that, includes full implementation of the Healthier Oregon program. I think just to emphasize, I don't know how often, we've had sort of 40,000 people who we have records for because they sort of touch the emergency sort of services, for them to have full Medicaid health coverage with a snap of a finger. So system-wise, we're ready to go since we had information on them. They are also going to have to go through redetermination at the same time. So it's all the things that go with starting a new program. So just really, I will just say from continuing down the path of assuring at least access healthcare coverage that moving the state, continuing down this path and adding 40,000 people in Oregon on July 1st is a huge game changer. So I did want to sort of sit with that a little bit of the difference of someone who may never have had health insurance in their entire life, and they may have been in Oregon for their entire life. So this is just, I like the amount of work, the amount of partnership with community-based organizations, with groups that work with farm workers, just a lot of great partnership to get this. And I think support from the governor to move this from what had been $100 million in this biennium to now, between the two agencies, over $600 million to fund this. That is entirely general fund appropriate. It's a big commitment for the state to do this. There's a lot of other sort of healthcare programs associated with that. We've talked about the waiver. As we're going through redeterminations, the legislature's provided dollars to support temporary Medicaid expansion as we're going through, between those that are between 138 and 200% of poverty, as we're looking to move to a basic health program. All those things are, I think, super exciting and important for at least having health insurance for so many Oregonians. A couple of other pieces, we did, some additional resources in child and family behavioral health to help provide incentives to recruit and retain counselors and other staff serving children, youth, and their families. Additional money for healthcare provider incentives with a focus on behavioral health providers, sort of continuing some work that has happened this session. Some work to continue work within OHA to assure that we are becoming an anti-racist organization, building some new capacity in the Oregon State Hospital for equity work there as well. A $50 million increase in the public health modernization program that has a big impact. As I think, as Liesl said, as federal dollars through the pandemic have slowed down, in some ways appropriately so, not losing what then allowed for additional resources to go into the public health system, state public health, local public health, and directly to community-based organizations. This will help continue that. So, I think, as Liesl said, that as with any legislative session, we didn't get everything we asked for. We got at least the things that we got that we didn't ask for. At least seemed positive. So there's always a little bit of both, of hopefully avoiding too big of surprises that you're like, I don't know how we're going to implement this. Now there might be, we're still analyzing things. There might be something that we missed. It's going to be, I think it's going to be a challenge to get everything off the ground quickly. But that's the challenge ahead of us.
Yeah, thank you, Dave. Right, the opportunities and challenges all rolled into one. Alyssa, how about Delk's experience?
Yeah, obviously a wild session for us all. I can talk a little bit about the early literacy kind of investments, which obviously are shared between the Department of Education and Department of Early Learning and Care. I think we were pleased to see the recognition that early literacy begins before kindergarten. I think we were disappointed to see that there's a separate expectation set for community-based organizations and early learning partners to explain how those dollars would be used. But the same accountability and expectation was not set for school districts. So we will be returning to the legislature by the end of this year with the plan for how we would use the Birth to 5 Literacy Fund dollars to be able to address literacy in order to receive the funds during the short session. So we'll be working really closely with the Department of Education and with the 9 federally recognized tribes to make sure we have a really comprehensive and collaborative approach to that plan, as we both have to go back for those dollars as districts get those the remaining funds automatically. So that was obviously a huge priority for the governor. Pooja Bhatt was the lead for that. We worked very closely with her and with ODE. And I think we're anxious to see what the legislature thinks of this plan by the end of the year. And I'll let David kind of fill in on some of the other policy bills that we saw move through this session.
Thanks, Alyssa. And we are also working on a written end of session legislative update that will go through, all the bills that impact Department of Early Learning and Care and the early learning sector, as well as an overview of the budget. So hopefully you'll be receiving that towards the end of this week. So I'm not going to go through all of the bills that passed this legislative session, but I think some of the highlights. I think we were talking just on camera just a few minutes ago, talking about the co-location fund for affordable housing and early learning facilities. Now we also will have the child care infrastructure fund more broadly for supporting the development of early learning facilities. This will be administered through Business Oregon. Legislature allocated $50 million in lottery bonds to support that fund. And then they also allocated some additional resources to Department of Early Learning and Care to provide technical assistance, and also work with community partners to provide technical assistance to really help early learning programs be able to access those resources. One of the other bills that passed the session, House Bill 2727, will create a new path towards licensure for outdoor preschools. This will be a pretty significant lift in trying to get this off the ground, because our current licensing rule sets are really based and structured around a physical space, a physical facility. So I think there's going to be some work to do to try to figure out to make this a reality. I am going to look at my cheat sheet for a second to remind myself of. I will also say that there are a fair number of work groups that came out of this session. I think, but one I think that's particularly worth calling out is House Bill 2727. This is actually a work group that DELC will be participating in, but not leading. It will be led by the Department of Land and Conservation Development to look at strategies to support facilities. Again, I think this is also an opportunity to look at the intersection of various kinds of regulatory structures at various levels of government, and what does it mean for an early learning program to navigate those different regulatory structures, and is there an opportunity to make that easier and less onerous for folks on the ground. There's also similarly work group. This one is actually for DELC to also look at barriers to entry into the early childhood workforce. So I think that'll also be an important opportunity to really think about what are some of those strategies going forward. We do have the investment in professional learning from the Student Success Act, but I think this is also an opportunity to think about what are some additional changes to the system to make those pathways easier for providers to navigate. I think the last bill I will call out, and again, you'll get a written version with more information, is House Bill 2683. This will expand eligibility starting in 2025, so really starting the beginning of next biennium, for employment-related daycare for families that are child welfare involved. So that includes both foster families and families where children are still with the family. And also expands to some additional population starting in 2027. So there's a lot of planning and work to do, including working with various IT systems to implement that. But I think those are important expansions to childcare assistance that came out of the legislative session. And Alyssa, any corrections or anything else you wanted to highlight?
I think the only one, I apologize if you said it, David, was 2717, which created outdoor preschool programs. So that's going to be a lot, but exciting work. We are very lucky that we have Washington, who's done this statewide, to really learn from, but wanted to just name that as well as something that it's not a work group. The policy has passed, so Alicia's team will be working on in the coming years to develop that licensing structure, because our licensing structure is very rooted in the physical space. So this will be an entirely different way of looking at licensing and compliance. So something else to look forward to in the coming years.
Another opportunity. So Ramona, I don't know if you have any updates from HEC, legislative ones that you want to share on very short notice.
Oh, no problem. Sure. We really have two areas that intersect with this work, and one is the workforce area, and that I think fared very well in the session. And it's pretty much the opportunities I already described in Future Ready Oregon. That money was reauthorized, and the work is going to continue. The industry consortia work, while most of Future Ready Oregon is paid for with federal ARPA dollars that are time limited, the industry consortia is actually a general fund program that is permanent. And so so that was positive news. The area that didn't fare as well was the student grant section. So either for people pursuing early learning and related degrees, we had asked for, I think, $5.2 million in grant dollars to be able to distribute for people pursuing that as a career. That we thought was likely to happen, but I don't know if it fell through the cracks or what. It just did not materialize by the end of the session. But there were a lot of things going on this session. So, and the other one was we had requested an increase for our Oregon Student Child Care Grant, and that's actually grants to students who are pursuing academic programs, and that's grants directly to them. But I think it's worth noting that it did get continued, and it is still a program that is available to people, although the expansion we had requested was not successful. So workforce, thumbs up. Student grants, not so great.
Okay, thanks, Ramona. I know it's always a plus and minus experience, no doubt about it. Okay, council, let's just open it up for questions, comments, discussion, thoughts while we have these wonderful agency partners with us. Supan.
I always have so much, but I'll pick this one first. I guess this is a question for all the department heads. Liesl, I appreciated when you were kind of opening up your comments earlier, you were kind of indicating a desire around timelines, deliverables, some specifics around the plan. And I feel like this might come from some naivete, but when I look at the plan, I feel like the bullet points that are in there are kind of purposefully kind of high level, in that the departments are being named. There's lots of letters next to each of these bullet points. And the idea is that people are coming together and they're getting to the specifics around, because they would know better what the barriers are, what is kind of needed to kind of move the work forward. I feel like the collaboration that's happening, the two most visible examples that I see when I look at that graphic of all the kind of departments and sectors that are involved, which is visionary and beautiful and amazing. And I wish, I think is a national example in many ways. But the two most visible places where I see it is in this meeting, the Early Learning Council, where, department heads are coming together and we're together like this, and then in our early learning hubs. But my question is there some other needed place where there should be collaboration? So I'm imagining, I don't know, you take a bullet point or a few of these bullet points and there's a dedicated group of people that isn't necessarily structured within the hubs, right? It might be somewhere else where those kinds of meetings are happening. I look at, for example, the home visiting work and how that, like there was a thrust, towards that. And so I'm wondering, I guess it's a two-parted question. Are there places where that's happening outside of the hubs and the council? And second, what else is needed in terms of that kind of collaboration?
Those are great comments and great questions. I think I'd say a couple things. I'm not sure what role the hubs play, so perhaps Alyssa can speak to that, but love to see more intention around local action. I think what I've seen, just to be honest about how state government works, I feel like what would help is maybe a quarterly progress report to this group from the people who are doing the work, because we all get busy and there's all emergencies. And if there's not that dedicated focus, and frankly, your outside pressure saying, hey, how are you doing? Do you have barriers? How can we help you? How can we give you advice from a community perspective and from your lens, then I think things kind of get a little passive. So my suggestion would be using this group in a more active way to both partner and frankly hold us accountable.
Awesome. Thanks, Liesl. Alyssa.
Can I follow up on that a little bit? Because one of the things I heard all of you say is it's going to be about implementation. Liesl, you stressed that. Alyssa, you're creating a whole new department and you're going to have to figure out how to make it real. Dave, you talked about the Medicaid waiver and what a challenge it is for implementation. And so I think that my follow-up to Subin's question is, if that's where you all are, how does a statewide council help you? Because we sit at a different level from that. What can we do to help you on some of these massive implementation challenges that you have now going forward?
Yes, I don't know. Liesl, Dave, Alyssa.
I was trying to be all appropriate and raise my hand.
Oh, go right ahead, Dave.
Yeah, I mean, I will admit it's a really good question and point, and sort of newer into this role and not as familiar with some of the history and some of the work. I will say that looking at the number of goals and strategies, it's a bit intimidating of what is important and what to really focus on. Because like, if there's anything that I've learned is if we focus on everything, we're going to focus on nothing. I don't know if I've even learned that along the way. But, I'm going to say that because I'm struggling even with an OHA of feeling that way a little bit because of coming off the pandemic. So I do think, and I think sort of in a partnership, and again, even back to some of the initial comments, where are those places that you all can help add emphasis and some accountability to say, hey, like all of these, are important and not, sort of, but we can't do all of them and we can't do all of them immediately. So I do think it's, whether it's, the right partnership with early learning hubs to do A, B, and C, just that a little bit of focus would really be helpful. And I think we could do that in a partnership way of figuring out, but saying that we're going to get all of these things done, together or at once or early is just not going to happen. So I think just where and what to really start a focus on is, to me, I think a really important next step. I hope that's not passing the buck and back, but it was intimidating to sort of read them like, that's a lot of strategies. All these seem really interesting and good. I start losing my focus to figure out how the heck we're going to get all of these done.
Right. Excellent point, Dave. I think we all can relate to that. Let me add 2 pieces of information and then see, Alyssa, if you want to respond to Anne and Lisa. One thing I want you to know is that another document that staff is pulling together for us is sort of a timeline of these actions. And they're breaking it into current, so those that are actively happening now, and then planned, so in the near future, an agency intends to work on it, and then aspirational, which is probably towards the end of our 5-year planning timeline. So we will be getting that document. So to some extent, that will address at least, what's urgent, what's happening, and then what's further down the road. And then the other piece, talking about, do we need a work group, or, where's the place that people come together for this? And Subin, sort of in response to your question, RUIACT, that we talk about at every single meeting, is sort of the central group team that pulls together from all of our 6 agency partners. Those are the leaders and managers in those agency departments that focus on early childhood and on Raise Up Oregon, and have played a critical role in putting this plan together. So I mean, that's at a high level, obviously, not at every action, but it is sort of the group that's been in existence now for 3 or 4 years that holds a lot of this coordination of implementation. So I just wanted to throw those 2 things into the conversation. So Alyssa and Lisa, do you want to respond to Anne? How can the council support the important work that you all are doing and be an active partner with you?
Sue, I put something in the chat. I mean, I think one concrete thing, Anne, is you all have influence with people that perhaps we don't. And I think just helping people just say, hey, the plan's got a few priorities. Let's give the agencies time to do that. So I think creating some space and cover for us to get to some implementation would be great. I think we probably all also learned this session, or at least I'll speak for myself, funding implementation is not super attractive, and yet that is what it takes to get it done. So, next session or short session, just really emphasizing we can make great plans, but they don't move unless there's, people and support to make them happen. That coming from an agency is not as powerful as perhaps coming from external partners.
Yeah, I would agree with everything that's been said. I think a tension I've been wrestling with, I had the opportunity last week to be in a room full of legislators from other states, because obviously our legislators were a bit tied up last week. And someone said something that I thought was really powerful. And it's that, often we talk about, wait lists or ways to convey the need, and that it's going to take 3 or 4 years to get there. But when we're talking about early childhood and the fact that 80% of brain growth is done by age 3, we're writing off an entire generation of children. And I think that's the tension we have to hold. I think we've definitely suffered, I'll speak for our agency, with having to plug a lot of holes and find a lot of solutions. And it's a result of the fact that this is an under-resourced industry that hasn't been treated as the infrastructure that it actually provides our economy and our families. We need food, we need housing, we need healthcare, and we need childcare if we're going to work. And I think there's a balance of how we can work with you all as the council to really hone in on that balance between like what can we actually accomplish and what's going to have that high impact. But I think the council can really hone the message, because I think to Liesel's point, we can say these things and there's always that distrust of, well, they just want more money, right? Like, so I think having those validators, the relationships and power you all have to make that message really clear. We are far outside of a nice to have space. We're in a crisis. And everything that's in this plan needs to happen. And it can't happen without resources and capacity and creative thinking. And it can't happen if it doesn't become a priority for the legislature. And we're limited in our ability to be that clear all the time. But I think the council really has the opportunity and power to say that very clearly.
Okay, thanks, Alyssa. Peter.
I was going to build off what Alyssa said. There's several points I want to make, but overall, I think what Alyssa just said is extremely important. The part about Raise Up Oregon that talks about financial security for families is so important. I hope that gets kept in perspective throughout the entire plan. We recently did surveys of, or did some data crunching here in Jackson Josephine, and 53% of the families with children under the age of 5 are at 200% or lower of the federal poverty level. So the work, Dave, that you're doing to make sure that those folks can get some help and have health care, extremely important. But it's the financial security over and over and over again. It's financial security. So everything Alyssa said, I just want to echo that intensely. I have a couple of specific questions. I guess, Lisa, for you, the discussion of the one eligibility system and expansion of that, have there been discussions on how that might be aligned with the Connect Oregon referral service? I'm just wondering if there's a possibility that work could be engaged in.
I am not familiar with Connect Oregon, Peter, so probably not at this point, but love to keep the conversation going. I mean, the dream is aligning. I think, as we all know, we're going to have to really focus on just making what's in front of us work. We've got about a 2+ year backlog of items that are in the queue, and we really want to stay focused on some, pent up early childhood issues that haven't been implemented, and of course with Healthier Oregon program coming online. So it's a challenge just to match aspiration with what's in the queue, but love to keep the conversation going, Peter.
We're at one of those kind of crossroads where OHA, the coordinating care organizations, are mandated to have a community information exchange, and that's what Connect Oregon is. So we're here working with DHS here locally. We're having some struggles on trying to just have the time for staff people to be able to understand what that referral system is. It's being used by the human service agencies. More and more people in education are using them as well. So it seems to me at some point we have to align those two systems. Otherwise, we got to have a lot of duplicative effort. Plus, if we could align them, the ability for families to access resources would be increased significantly. And at a point on two of what Dave was talking about with the Child Care Facilities Fund, which is fantastic. I was at a meeting yesterday. There's already people asking about those funds, David. So just so you know, people want to know how to apply for the technical assistance part. I don't know how long it'll take before that information comes out, but people are already asking about how can they apply for technical assistance? How can they start looking at billing facilities? And also, I think the news about the outdoor preschool licensing is fantastic. We have a couple programs here that are they're doing great work, and I think that's just gonna be a great step in the right direction for us. But again, just let me emphasize, I can't emphasize enough, the financial strain families are under, particularly families with children under 5, it's just unsustainable. We have to do something to address it. Thanks.
And I dropped a link in the chat to that point, Peter, on the rapid survey. Phil Fisher had started this during the pandemic to really recognize that what families with young children were experiencing was going to be pronounced in a different way. And they've continued that work even as he's taken it over to Stanford. So I've dropped a link in the chat, but I think it's such a great example of how all of our work connects, because it talks about, housing, it talks about healthcare, it talks about what our families with young children are experiencing and how that's manifesting in, toxic stress and just what children are going through right now. So encourage folks to kind of poke around and check that out.
Yeah, thanks, Peter. As always, great input and questions. Anything else from council members? We just have a minute or two left. Subin, is your hand up? Yes.
I'll be brief. Ramona, I just want to express a lot of gratitude that you're here and that HEC is here joining us for this year. I love the stuff that you were naming as kind of points of emphasis and places where we could start. I'm also looking forward to, in 2015, there was the Transforming the Workforce report published by the National Academy of Sciences, Engineering, and Medicine. And I feel like there's so much in there that also just implicates the HEC, right? And so I'm just looking forward to more conversations around articulation and transfer agreements, how we're dealing with admissions, changes in delivery in terms of higher education. And I hope that we can kind of move forward with some of that, with some hopes and dreaming and planning.
That would be great. We have had some gains in the transfer work. We've come up with and had approved some common course numbering, and we are starting to make progress on the plan to make that easier for students. And so we're absolutely going to keep on that path. The other thing is we have an office within HEC, the Office of Workforce Investments, that is above and beyond Future Oregon, that works on workforce strategies all the time. So we're doing a lot more. And I know that in our executive team, we regularly discuss, how are we going to help early learning or, early childhood development, all those strategies, and really make a career pathway that will be attractive to people and that will keep people in the field. So
awesome. Thank you. Well, I want to thank Lisa, Ramona, I think Dave has had to leave, and Alyssa for joining us today. And Lisa, before you leave, I just want to acknowledge the partnership that you and Claire and your staff have provided over the last year or more in this incredible move of ERDC over to DELC. We're going to be adopting rules at the end of our meeting today, and I don't think you will be here for that, but I just wanted to acknowledge that partnership while you're still online, and we really appreciate it. And we know that we're still partnered in ERDC for the foreseeable future. So I know it's not ending. Alyssa, clapping. Yes. So thank you, Lisa, very much. And Ramona, thank you for joining us today. We'd love to have you anytime. So have a great afternoon. Goodbye. All right, Council, speaking of Raise Up Oregon, we have on our agenda today, as you know, time set aside to look at the final draft, which was in our packets. Huge thanks to our build partners, Harriet and Carrie, for joining our staff, and RUIACT in getting this to this point. And Remy has been a key partner in that, as well as David and Alyssa and others. What I'd like to do now is we're going to have, you saw the memo in the packet that I wrote concerning this. part of our agenda. I think acknowledging the addition of transportation into the plan, because that's based on a lot of feedback that we received in the engagement process. So it is in strategy 14.1. And once again, will be multi-agency and aspirational. But I'd like to see if there are any comments about the plan itself, and then hopefully have a motion to adopt it. And then I want to have a robust conversation about dissemination. And, you know, the plan isn't going to go on any shelf. So how are we, the council, going to play a role in making sure that it is an active document? And how can we help get it distributed in our own networks and regions? So, Harriet, I don't know you as sort of the master writer of this document, want to lay out any overview for us as we discuss it?
Okay, I'm happy to do that. So we included in the packet the updated version of the goals, objectives, and strategies. And we've talked quite a bit about the ongoing improvement processes to these, both the work that was done prior to the last council meeting and then subsequent editing. So we've continued to refine the language, and as I think Sue even mentioned, not in the version I think that went out to you, but we do think in the public version, the agencies have been extremely cooperative in terms of noting for all of the activities, which things are current, which things are planned, which things are aspirational, so that I think we will have a good way in the final document to be able to assist people in understanding some of that question, where is your focus today? Okay, as well as where are we trying to work cooperatively for all of you as council members in that leadership and champion and advocacy role to be able to move the things forward. I just wanted to mention that, as you all remember from the first version of Raise Up Oregon, that while you have before you the sort of blood and guts, the most important part, right, of the plan, that we do have these other sections basically that introduce the materials, and they stress themes like racial equity. All right, they stress the information beyond what Alyssa just mentioned about the importance, not just to the early care and education agenda, but the documentation of the importance of healthcare coverage and healthcare access in terms of longevity and impacts basically from the earliest stage for children, so that the introduction, continues to take our theme that we are trying to emphasize in this version, and particularly of Raise Up Oregon, that this is an early childhood plan, and it is an early childhood plan across these systems because all of them are important contributors in the near term and in the long term to the health and well-being of children and to Oregon's economy as a whole. So those are other parts, just to alert you to basically that we'll see in the published version. We have, as I said, we've had really great cooperation in terms of the agency participation in this plan and their contributions and the seriousness, I think, with which the staff members who participate in the Raise Up Oregon Implementation Action Team basically have been putting things on the table, defining the partnerships that are such an important part of this, and helping us to move things forward. So we are on track. Basically, I guess this is the best thing to say, maybe, Sue, before maybe to ask for the motion. We are on track to get the plan ready to go to the designer in July. So that means that we will be able to have the plan available and really start working seriously on the dissemination by September, which I think means today is a really great moment for us to hear from everybody on council around the issues of dissemination basically moving forward. So it's not just ideas for yourselves of what you all want to do as council members, but other ideas as well. I think we would agree that a signature impact from Raise Up Oregon 1 was that the dissemination efforts went really well, and that people came to know as a general matter that this plan existed. And so I think hopefully we want to aim to be able to do the same thing. So I have one other thing I realized and I should mention, because it came up so much in the call in the part of the meeting prior to, which is implementation. So I did want to mention that there has been more considered discussion for this version of Raise Up Oregon already around tracking implementation among the agency partners. And it's not settled yet exactly how that will go. They're still kind of debating, but there was a really robust conversation last week from the Raise Up Oregon Implementation Action Team members, basically about what kind of tracking, how to do that, what was tracking for, what kind of ways would everyone be able to support council in terms of issuing more regular progress reports and being able to be more reflective, both about, successes and if things are needed to pay attention to things that were anticipated to have a more prominent role than warrant. So I did want to share that because I thought that was really encouraging, and it speaks to the issue that the work has continued to be elevated beyond the early care and education work or early care and learning work that kind of was the first foundation, right, for Raise Up Oregon, so that I think we are seeing the foundation more embedded in all of the agencies and a greater desire, which I know all of you share, to be able to keep asking the so what questions. Okay, we said this, what have we been able to do and how much progress are we making?
That is a very exciting report, Harriet, from the RUIAC meeting last week, because they are just such key parts of the implementation, as the drafting and creating, as well as now the implementation. So council, thoughts, reactions, how are you feeling about the adoption of this plan? Peter?
I think it's a remarkable amount of work, and it's a remarkable plan. I think the reason I joined the council was because I read Raise Up Oregon 1, and now I'm just really pleased to see how the evolution has come with 2.0. It's comprehensive because it has to be comprehensive. I'm with Alyssa on this. Alyssa said that all of it needs to be implemented. I agree. It all has to happen, but it has to be put in place. It has to be there in front of us first before we can start doing the work to make it all happen. So I just want to compliment everybody who's been involved with it. It does, when I read it, it does put some pressure on the Early Learning Council, put some pressure on us, which it is good. Particularly around the one spot that really jumped out at me was two. One, I get really excited about the parent mentoring, expansion of parent mentoring really gets me going. But section 4.1, talking about the Early Learning Council and our ability to be advocates and at least partnerships with the business community. I think that, I hate to suggest this, but we might need another subcommittee soon. We might need another committee that focuses on just how are we going to expand our impact, to follow that part of the plan, to really actually engage with the business community and the larger community. But great work, everybody.
Yeah, good point, Peter. The business community is absolutely key and becoming more so, especially in the childcare sector. I think the facilities fund is going to really bring some of them to the table.
And just, real quick on that. So the meeting we had yesterday was with Asante and Providence, who are our major healthcare providers here. They asked for a meeting to talk about how they could help in develop a couple facilities in the Rogue Valley. So they were very excited to hear about the possibility of the funding.
Awesome. Yeah, I think a piece of our role is this communication piece. How do we get all of this information out through our networks and in our regions? because we heard about a lot of things just on the call today. You know, what Ramona was talking about with some of the, workforce issues that they're involved in, and they have money. So, it's not necessarily a lack of resources to make this happen.
Well, it would be great if we just made sure that each one of our hubs has a partnership with the workforce development people in their communities. Sorry, Katie, I just jumped in again.
No,
You just said what I was just going to say.
go ahead, Katie. There's a
You
lot
just
of
said what I
talk
was just
about.
going to say. I think this is a really great opportunity to really utilize those hubs effectively and get the word out. And I'm having the same conversation with St. Charles here in Bend, and getting not just only their childcare for their facility, but banding together. There's kind of a cluster in that part of town of healthcare providers of various sorts and sizes, and maybe doing something collectively there and tapping into some of these ideas that came out of this session. So in fact, I'm freely admitting I was multitasking, and I sent out a note to my hub person, Brenda, and others saying, oh my God, have you heard about all this stuff? When are we going to get together? So we can translate this information into something that's digestible to some of the business sector and others that want to tap into it.
There you go, Peter.
Actually, Peter, we would love to get your feedback even on that document, because we were thinking that particular document wasn't the model for doing the easy to use, easy to persuade the community document this time.
It's just great to have a document, and I have found it useful. I've taken this to various groups and passed it out. Our hub has some laminated copies that they pass out to. I found it useful, but we need to have some sort of one pager that can explain it.
I think we definitely have to create the one pager, and I love that you seem to have that laminated. That made me happy if that's what you did with it. And but I think we didn't get to include the whole plan or something in that version. So we were thinking of we don't know what it would be, but that's one of the things maybe for people too. And I already heard, right, people saying we need to make sure we have some outreach document that is going to be targeted to business leaders, right? Because that's important for council's role, and it's important for growing constituent partners. And so that's helpful, basically, to hear that already. I'm just wondering, and then I heard you, Katie, you were talking about hubs, and last time hubs were actually asked by ELD at the time to actually come up with their own, like, how were they going to move this forward, which was really awesome. The hubs did a great job of that last time. I think that maybe is on the table. And we asked, Carrie and Remy and I asked the agencies also to think about that for their equivalent, any equivalent partners they have, right, to sort of seek that out. But again, it would be good to continue to hear about who do we see, right, as the core audiences, and what are the best ways that you all have about how we might be able to make the dissemination as relevant as possible. Cully, I think, was talking about videos, maybe. That might be a possibility, but whatever initial thinking people have, in addition to what you share, will be great to hear.
Yeah, actually, Kelly and I, she's not able to be here today because not feeling well, but she and I actually talked about how do we make this relevant for families as well? Is there a way to turn some of it into cartoons or, just have a lightness to it, but make it relevant for families whom we hope will benefit from this work. So we can try to be as creative as possible. Anne.
I really loved reading it again and reading it now in its entirety. And it really is an impressive document. I mean, I think it is probably as I think Subin, you said this, maybe a national kind of model. And at the same time, it is a lot. And it's also sort of overwhelming. And so I'm also sort of thinking about what Liesl was counseling about. How do we pick up a few key themes and make sure that we just focus on those? So that's what's sort of in the background of this. So first of all, congratulations to everybody who worked on it, because it really is impressive. I mean, it really is. What struck me when I really reread it yesterday in preparation for this meeting was that there's a lot about workforce in there, which is really great. And it's in several different locations in it. And I wonder if we want to spend some, I don't know if there's some way to sort of pull that together and sort of think about, okay, these are all the pieces that we need to work on, and that's right. And so what's the overarching picture of where we sit on that was one of the things I came out, because it's good and it's strong on workforce. It was great to have Ramona here today to talk about that. And so that just struck me. I didn't remember us being so strong on it in the first round. And so I was really pleased about that. And then of course, the second thing is about really calling out the hubs and saying, we've got to focus on the hubs. I'm glad we called it out. There's not much meat there yet in what it is that we expect the hubs to do, which I guess is sort of what we were just saying. It's basically saying, okay, hubs, like we have to get to, system partners locally, families and community organizations, state design policies, and so on. So I think there's work to do to unpack that a little bit, but I'm glad we've called it out in this report. So that was the second thing that really struck me that I really liked. I just want to say a little question about the business community. We have a new resource in our state now. The husband of Lisa Mensa, the head of the Oregon Community Foundation, is the head of something called the Council for a Strong America, which is that national organization that is about bringing business and I think military leaders into promoting, attention to child well-being. And so we might have actually a new resource in our state that we could bring into this question to talk with us, because that's what he's got those connections nationally and knows what's going on nationally to do that. That's another comment. And then my last question is, if I noticed a couple of little typos in here, should I send them to somebody?
We're going to actually have the document copy edited. So we just
okay.
haven't gotten to, we're waiting for the whole intro and appendix of the glossary and everything to be done and send it to the copy editor once.
But Anne, it's fine. If you see
Yeah.
something, you just definitely send it to us.
Yeah.
Okay, feel free, because we have a whole master document, which isn't, you didn't see the whole master. Sue has seen the whole master, which has the intro and all these other sections.
Yeah, so
but yeah, but it's just fine. And the only thing that will be helpful, if you don't mind, is if you could maybe do it in track changes or just show me where in the document the problem is. And then I'll make sure we get there, but we haven't gotten that far yet, as Carrie said.
I'm not even okay. I'm not going to worry about it. I can't help myself. My staff gave me a mug that says on it, "I am silently correcting your grammar."
We totally understand. And the reality is it's actually really hard to do. That's why I'm saying feel free, but I don't want you also to feel like we gave you something that had been to the copy editor already and so forth, because it hasn't
I'm
been.
not going to worry about it. Okay, thanks.
I mean, I'm also interested, Anna, in the insight of what would be helpful to the council on the prioritization, because the plan is a mix of planned work where state agencies said, we're already underway. It's either we're the lead or we have a partnership or there's 3 of us. And then there's the Aspire stuff. And so in the past, with the first plan, we did do a whole process with RUAC. They did a whole day retreat with us. And we did a whole prioritization of what was kind of green, like underway, funded, clear next steps, actions, yellow, like kind of in between, and red, like either no movement, total aspirational, or there's an order to the work. So there's some things that have to happen in green and yellow for the things to happen in red. That still didn't get boiled down to what Harriet and I would have said to the council. Here's the top 3 things that should have our focus. So I am intrigued by this ongoing conversation around implementation and the updates that RUAC will be working on of the whole plan of everything that's green. But then what does that really mean for all the state agencies with the council of saying, here's our top 3 priority. So I wouldn't mind ongoing exchange with all of you as we come back with
Right.
you with RUACT, getting clearer. They've started the brainstorming of what they think they want and how they think they want to do it. But just know that Harriet and I are always thinking about implementation and how do you keep track of what's not being paid attention to as much as what's moving forward, and what are some of the activities that are really the responsibility of a single state agency because it's deep in their expertise, and what are the things that really require 2 or more state agencies coming together. So for the collaboration coordination piece, where are people spending their time that will be the most effective and the most impactful and the most worth their time, because we know in a lot of our state agencies they don't have a lot of things around system building, collaboration, and coordination in their job titles and job descriptions. Right, so always wanting to make sure it'll have the greatest impact for communities and families of like where are they spending their time trying to figure out where to coordinate and collaborate.
Kara, I just wanted to add to that. Sorry, Sue.
Yeah, Katie, excuse me, Katie needs to leave in about 4 minutes to go run another meeting for a little while. So I'd love to get a motion on the table and passed, and then we'll come back to this very important discussion. And the motion, excuse me, is in our packet. It's on whatever the page.
I can do that for you, Sue.
Great. Will you make
Read the motion.
one amendment to it, Katie? I think the last part needs to be to meet our legislatively directed goal of coordinating a unified and aligned early childhood system. It's not strengthening a system because we don't really have one yet.
Coordinating and aligning.
Yeah. Coordinating a unified and aligned. That's out of the statute.
Unified and aligned. Okay. Let's see if I can get it right. Okay, so I move to adopt the draft version of Raise Up Oregon, 2nd edition, dated June 2023, which contains the finalized goals, objectives, strategies, and actions to champion between 2024 and 2028 to meet our legislatively directed goal of coordinating a unified and aligned early childhood system.
That's it. Will someone second that?
Second.
Thank you, Peter. Any further discussion of this? All those in favor of adopting this amazing 2nd edition, say aye or raise your hand.
Aye.
Aye. Any opposed? Motion carries unanimously. Well done.
Yay.
Yeah, yay is right. And now the work begins. Oh, wow. Okay, thanks. And Katie will take you as long as we can have you, but I know you've got another obligation. So sorry, let's go back then to the conversation that we were having. And yeah, Carrie, your point about some of these are really kind of driven by a single agency, and many of them are going to be the multiple.
Right. What we've done in the past is we took all the ones that were multiple, and then we did the like, how planned is it? Like definite funding, definite partnership, work groups already moving forward, or anticipated money and planning. That's all you're right. So we did that kind of work. So you could then start to say, when RUAC meets monthly for 3 hours, what's the focus of the conversations? While other work is moving forward, how do we prioritize where we're working together? And what needs. And I think but I am intrigued by this, like, what's the feedback loop with the agency directors? What's the feedback loop with the council? How does the council, like, and you noticed a workforce theme all the way through the document, just not grouped under one goal. Are there a few others that we should start seeing how many of those things fall into a kind of a green bucket of like planned, and how many of them fall currently in the aspirational? And what would that mean to unlock the kind of potential or the kind of outcomes you might want to see within 5 years of this plan?
I just wanted to reinforce, Carrie, the part around too, let's just say aspirational,
Yeah.
because in the past, right, council has decided to focus, right, you're being a champion on some selected items. And so I think as we are able to share the things that seem further away, a great idea, but there isn't a concrete approach, that will be able to allow thoughtful conversation here as to whether those are places council wants to elevate its voice and its engagement with agency directors, right, with legislature, with others in community.
Hey, Peter.
I don't know if it's helpful to think of. I'm glad that Anne brought out workforce, because it is throughout. The hubs are also throughout as a second major area of focus. And then direct support for families is also pretty consistently stated. And it'd be great to know, if we can get a clear picture about, okay, what are we doing as a system in order to make sure the hubs are operational, effective, and then what are we doing as a system to what part of this plan has direct support for children and families?
Yeah, it's interesting. We're sort of identifying buckets of priorities, and whether we can apply a filter to this amazingly detailed plan that kind of pulls out some of these themes, whether it's workforce or direct support for families, hubs. Community connections is another, community engagement. That whole family voice is, and the role of CBOs is another theme that we see all through this, and that our partners have talked about a lot. Liesel's saying, we want to move things so that the CBOs in our regions are really at the table and making decisions. So there's certainly, I think, that move from the state agency's perspective as well. Subin.
I'm zooming into strategy 16, which is where my work has been for the last, 7 years in terms of that interface between early learning and school districts. And I feel that, when I read this strategy, I see transition and some language gymnastics, but I interpret it as P3 alignment. When we talk about continuity, I understand the gymnastics that you had to do. As far as dissemination, one of the things that, I think about is that there's this bifurcation in terms of how people are getting their information in K-12 and in birth to 5. And so I would say that one of the things that is commonly heard and understood at kind of a regional, local level is that the school districts just have more resources and power in terms of some of the tables that are being set. And so one of the things that I know kind of is a place where people are getting their information in terms of school districts is the COSA conferences. And that's a place where people are getting some of their information around early learning. So I wonder if there's something that can be worked on there. And the other thing is, when I look at some of these bullet points in regards to school district work, I feel like there are examples that have not been really visible out to other other regions, other hubs, other places that are trying to work on P3 alignment. And so I wonder about how to make those visible. I feel like conferences are like kind of a natural place where things like that happen, but I wonder if there's something else that where, for example, there's something emerging in the Portland metro region where a bunch of the early learning administrator folks that aren't superintendents, right? The early learning coordinator types are kind of convening and coming together. And so, and I know there are other regions and areas where that's happening. And so I think that's a place where there's some exploration and discovery we need to do before we can get to the dissemination there.
Subin, who's driving that part, the preschool part or early learning part?
In the Portland metro area? That is a self-organized. It's one of the most beautiful things I've seen. It's when the early, they all happen to be districts that are touched by Teaching Preschool Partners, our organization, but they have self-organized and say, hey, we need our own community of practice. You know, we're creating communities of practice for our teachers, and as administrators, we need a place to kind of do that. And so it is an unfunded, self-organized just group. I think there's alcohol involved.
That always helps. Anything.
Yeah, it's just this beautiful thing that has emerged. And so I think about, you know, the fact that it's being self-organized like that tells me that there aren't, you know, there's still work to do to kind of create the infrastructure for people to get their information and to share, because I think they're kind of pulling from bits and pieces all around.
Okay, well, I think one thing I'm hearing is that Suben is volunteering to help us figure out how to disseminate this in the K-12 system. Sort of. That may be overstating what you're saying, Suben, but
I have a lot of enthusiasm and energy for Strategy 16. Absolutely. Yes.
good. Thank you. And truly, you know, connecting more to the K-12 system, I think is an important directive. When I talked to Colt yesterday, really briefly, he was saying that if, you know, that needs to be one of our shared goals for ODE and DELC is greater communication. Yeah, exactly, Peter.
And just on that, I think Kali and the Children's Institute can help us a lot. We've been partnering with Kali and the Children's Institute on several pilot programs. There's one in Young Collie, you know, there's one in David Douglas. We've got expansions of a couple of places on the coast where, so they've got some places that are really piloting really good P3 alignment, and so they could be helpful in this too.
Thanks, Ann. Good.
And then Peter, of course, yeah, and then in Southern Oregon too, right? Yeah.
Josephine County, absolutely.
And there's a new one emerging in Burnt River in Eastern Oregon in Union County. So
wow, Burnt River.
So we're looking for them everywhere. Wherever there's energy, wherever there's local energy, we're looking to support it.
That is so cool, Ann. Wow. Okay, Carrie and Harriet, what are there specific asks you have of us council members concerning dissemination? And
Yes.
Okay.
So these are really valuable suggestions, and there's obviously a lot of great ideas. One of the things that we would like to ask each council member to think about is how you want to be engaged. And I know we did this with the last draft as well, that people either presented locally or used your own networks. And so we'd like to try to get everybody on board for that. And it doesn't have to be right now, of course, that people say what it is you would like to do in your role, basically. And Suben, of course, you were volunteered a little bit by Sue in terms of at least working to help us establish a good strategy for the connection for the early learning and care and public education, right, K-12 aspect of it. But I think, Sue, that is something I'd like to plant the seed for people today. If people already know because you've been thinking about this, I can't wait to have this because I'm going to go talk to so-and-so, that's great. But if people aren't ready, then we can figure out a good outreach strategy to everyone to kind of hear where it is council members kind of want to use your own standing in community and your own networks to advance understanding of the plan. And then as well, as you think about this, that may help a little bit too with any additional ideas you have about dissemination tools. Okay, last time we had the placemat that Peter held up. That's what we called it. Peter was the placemat. We had the plan as a whole. We had the website, right? You know, those are things we did. We actually did do a slide deck last time. Okay. And people could mix and match their slides. So I think that we're still thinking those are basic tools plus the part Sue referenced. that came up at the council meeting where we talked about these other audiences and do we have a friendly or possibly more humor engaged way to come up with a version of the plan. But again, as people are thinking about where you'd like to go with your own leadership time and energy, if you do have ideas about collateral, that would be super helpful just to keep us posted.
Just picking up on our need for really sort of engaging the early learning hubs, I wonder if that should be a primary audience that we could do sort of each of us could sort of pick a few early learning hubs, or we could have a show and tell and go and meet with the early learning hubs and work through it. And I wonder if that would be a really good first priority audience.
It's certainly consistent, and also with the role. If you look at the plan, you know how we have this time distinguished between things council will do and things your kind of agencies will do, that you may be praising them and prodding them a little bit, right? But that's really consistent with some of the engagement and the way we outline council responsibilities in the plan.
Well, and the hubs have come up at every single council meeting that I can remember. And so I was talking to Alyssa and Serena a week or two ago about putting together perhaps a formal committee of the council to focus on the hubs. We've kind of talked about this for many months and just haven't done it. And Peter, no, I wouldn't ask you if you'd like to co-chair it, but you're already there. But we were talking about probably in mid or late August, trying to pull together a couple of council members, some of the hub leadership, and some of the agency leaders who are interested in the hubs. So not just DELC, but OHA has expressed a real interest in including the hubs in some of this waiver implementation work, and ODHS in connecting them more to their regional offices, their district offices. So I think it would be a multi-state agency as well as a council effort, and just see what we can do about really focusing on the hubs this year. So.
Well, Sue, my instinct is just as soon as this is ready to sit down with Renee, with our hub, and just say, how do you want to work together to get this information out? And she did a great job last time of really being a focal point. So I don't want to chair another committee, but I want to be part of that discussion. I want to help have that discussion.
Great. And Renee is certainly, we've got some outstanding hub leaders in this state, and we just need to take advantage of their expertise and the community bases that they've built.
Yep.
A lot of them are doing exactly what our agency partners are saying needs to happen, but somehow we aren't getting that information up to the state level. So I think we can play a role in that. So just to timeline, I think, Harriet, you said in July you're sending it to your whomever your build wizards are.
Yes, we have a plan. We are well on our way towards a final. And, Sue's reading the whole thing now, which just so everyone knows that she's committed herself to reading the whole. And so we'll have changes, and then we're in great shape to be able to send everything into the copy editor and writer who will help us. And then we have lined up a designer, and so that we can start to work with the designer. And the one thing that we just haven't figured out as well, we have to caucus still about the 1 page or the short document, and what we think will be most effective. And then also, I think we have some more thinking to do about the really family-friendly piece, basically, because I think we do all know that for the professional type audiences, we have the glossary, so people will be able to look up things at the back that relate to systems they don't know about. That's not the way to do it for families. So those will be creative things. But I feel overall we are really in good shape for having something so that, as it were, so the release date, or whatever we want to call it, will be just in great shape for September, being a busy time for the state agencies to be out there promoting the report, for council to do things, and to really begin to make it come alive and have renewed energy around making more progress for children in the state.
Yes, and one of the things we've talked about is in September is seeing if we can tie this into Ledge Days and get some kind of launch with legislators so that they know that this plan is also being implemented and a roadmap for them to use. So it'll be another exciting year. Oh my gosh. On behalf of the council, I want to again thank Harriet and Carrie and Build for your leadership in this. We would not be here without you. I don't think any of us questions that. And I want to thank our philanthropic partners, including Anne and Ford Family and OCF and Miller Foundation and all of the foundations who are helping to fund the Build involvement in our work. So lots of partnerships, but thank you sincerely for all you put into this.
Well, I guess I'll say for everybody, Sue, thanks back to all of you. Carrie and I really enjoy the opportunity to work with the council members and with the state staff, and with community members. And so it's really awesome to be able to work in a place where people are working hard to try to think about the work in a comprehensive way and not just get stuck in one portion, right, of the agenda. And that's, as you all know, it's tough, right? And so it's really a great opportunity for us to support all of you as the work is moving itself forward. So thank you.
Yeah, and I have to agree. I think, Peter, it was you who said earlier that Harry and I use your Raise Up Oregon nationally as examples for other states when they're like, what is the system building? What's this cross-sector partnership collaboration you're asking for? And I'm like, look, it's possible.
Oh, good.
Yeah.
Well, you guys are having an influence way beyond our borders, which is awesome. All right, council, it is noon, so we will take a half-hour break, grab some lunch or whatever, and come back at 12:30 for another amazing culmination of 6 to 18 months of work in adopting our rules. So thanks, everybody. See you at 12:30. So Chris, if you are on and hearing me, hi.
Good afternoon.
Hello. So Remy sent some updates to the rules information. Is it anything substantive that we really need to call out?
No, they're just minor language changes, and one is just the chart for the rates. So it's included in the notice proposed rulemaking, but just wanted to give council members a heads up if they reviewed the rules in detail that there was some slight modifications in language, but they're not policy changes at all.
Okay.
For the ones that have some income changes, Kayla will go over them in the presentation, but they really are very slight.
Okay, and Kayla is presenting rather than Jordan.
Yeah, Jordan is having some internet issues today, so there's some back and forth, but Kayla will be presenting.
Okay, from Rhode Island.
But we're going to do temp rules first for contested case hearings.
Right.
Yep.
And then the certified center and then the RDC.
Yes.
Okay, and I assume they're going to put their PowerPoints up on the screen. And
Remy might be sharing screen because I know Remy was going to be sharing screen with the council action request, just so we would minimize screen sharing.
I have everything up and ready to go whenever everyone's ready.
Awesome, awesome. Hi, Kayla, welcome. You thought you were done with us.
Not quite. I always knew we'd be here. This meeting, this is the meeting, Sue.
Oh, good. Well, I heard you were otherwise occupied these days, so.
Yeah, yes, it's a busy time. Jordan is also with us, but will be off camera due to some street internet service disruptions. Normally you'd get the presentation from her, but today I'll pinch hit, but she's here.
Okay, great. Thanks for pinch hitting, Kayla, and Jordan, thanks for being on your phone. So let's see, Peter is in his car in transit to another location, so he'll join us in about 10 minutes. And Katie will be back about 1 or 1:15 after her conference call. So I think 1, 2, 3, 4, and Peter will 5 and 6. Okay, so Remy, let's go ahead and get started again.
Okay, yeah, we're going to start with Alicia with the Office of Child Care, some temporary rules. We'll move on to the Certified Center rules, and then we will do the ERDC rules last. And Alicia, I'll start screen sharing the presentation right now.
All right, welcome, Alicia. We're glad to see you again. Thanks for joining us and putting this information together.
Thank you, Chair Miller and members of the council. Just for the record, I'm Alicia Gardner. I'm the OCC director. And I am here to, sorry, I just need to put something on silent really quickly.
No problem.
Okay, didn't want you guys to hear a bunch of beeping in the background while I'm talking. Okay, so I'm here to put forward to the council some temporary rules related to contested case hearings. If we can go to the next slide, I'll give an overview of what we're looking at here. So House Bill 3073 in the 22 short session passed, which did give union representatives authority to represent childcare providers, family childcare providers, or represented childcare providers in contested case hearings. So what is a contested case hearing? So OCC is authorized for legal actions for both facility licenses as well as CBR enrollment. These types of legal actions have hearing rights and due process. So when OCC takes a legal action, such as a suspension, revocation, civil penalty, a condition or a denial, the individual or the owner of the license who we are taking action against has hearing rights, which means that they can contest that legal action in front of an administrative law judge. So these providers are able to now be represented per the law under either pro se by themselves, through an attorney, and now they have a third option, which will be their union representative. This bill goes into effect to July 1st, not tomorrow, July 1st, 2023. And due to time constraints with the creation of DELC, as well as all the other massive amount of rulemaking that you are voting on today, we have opted to go for temporary rules right now so that we can really take some time to do deep engagement with family child care providers and the community throughout the summer to look towards permanent rulemaking in the fall. Currently, there's only 2 scheduled hearings within OCC, and neither are likely to go to hearing earlier than September 2023, but they may be heard before December 2023. Also, the rule making in and itself and the rule language itself is aligned and borrowed from language within statute, as well as DOJ's model rules for contested cases. And then there's a few other rules to include and clarify consistency and with respect to anticipated questions around the participation of union representation beyond the scope of the hearing itself. So if we can move to the next slide, you will see here that we have 3 sections for this rule, and it will go into a new division called General Rules for All Child Care Facilities. So therefore, it will apply to all the providers that are applicable in this, so registered family and certified family. And then you see here there are 3 simple sections: the applicability, definitions, and then the actual rules themselves, which describes the process for contested case hearings. Next slide. And then just quickly on the next steps, which I kind of already spoke to, but we're looking to draft the permanent rules, conduct a RAC to gain feedback from community as well as those who are impacted, and then present this to ELC for review and proposed adoption in December of 2023 with a full implementation in January 2024.
Okay. Is that it, Alicia?
That is it. I'm here if you have any questions or comments.
Okay, thank you. Any questions from council members? If not, I've asked Anne if she would do the motions for these rules today, since there are quite a few. So Anne, would you put a motion on the floor, please?
Yeah, and you can help me figure out how to say this properly, because my understanding, Chris, is that we don't actually have to read every single number. Is that true?
Or the temporary rules for contested case hearings, that just because there are only a few of them, it would be helpful if you could read each of those.
Okay.
And would you be able to share screen for the council action request as in?
Remy, can you share the screen?
I'm pulling it up right now. Let me do this. Okay, here we go. Share screen. Okay.
Okay, so I move to adopt the proposed temporary rule language dated June 28, 2023, that adopts Oregon Administrative Rules 414-075-0000 and 414-075-0010 and 414-075-0300.
Great, thank you, Anne. Is there a second for that motion?
Second it, it's Peg.
Okay, thanks, Peg. Any comments, questions about the motion? If not, those in favor, please say aye or raise your hand.
Aye.
Aye. Aye. And Chris, when Peter gets back on the line, actually, I didn't think about this earlier. We'll need to do this motion when we've got Peter back so that we have a quorum.
Yeah.
Okay, so.
Good. So that was my practice reading. I get to read it my time. Okay, good.
Sorry about that. I didn't do the count earlier. Okay, so let's go on to the Office of Child Care update on certified center rules revision. And Abby, we're glad to have you back again.
Oh, thank you, Chair Miller, and fellow council members. For the record, my name is Abby Strom, and I'm the Child Care Initiatives Analyst with the Office of Child Care. And I'm here to give a brief overview of what has been presented at prior ELC meetings in preparation for the proposed adoption to rules that apply to certified child care centers. Okay, next slide. Thank you. I just wanted to refresh our minds around the guiding principles of our rule revision project. This is a big project, and this is the second set that we will be revising. This rule set in particular was developed using these guiding principles, and they will continue to anchor our future rule revision as we look towards rules that apply to family child care in the coming years. And also you will see that these guiding principles are really reflected in much of our amended rule language. Okay, next slide. Just a reminder of what we have presented previously. In March of this year, we presented information based on themes that emerged over the course of listening sessions we conducted in fall of 22 with representatives from child care centers. In addition, at that meeting, we presented to the council proposed rule language that was developed in conjunction with a community rule revision work group. The proposed language was focused on staff qualifications and related duties, staff to child ratios, and infant care. Those were the three themes that emerged from our listening sessions. Just last month, we presented information related to the makeup and feedback that was received from our rulemaking advisory committee, who was able to review the complete draft rule set. During the council meeting, we presented rules that address specific barriers that had been removed or reduced to support childcare operations. We presented how rules had been adjusted to provide programs flexibility to provide care to wider age ranges, specifically to our youngest children in care, infants and toddlers. We reported about the appreciation for the increase in communication between childcare programs and families, and also the increased clarity in rule language and OCC processes, which supports compliance with rules and also reduces administrative barriers to childcare programs. Okay, next slide, thanks. Since my presentation in May, we have completed all of our rule advisory committee meetings and incorporated any feedback where possible. In addition, we had the closure of the public comment period. We received one piece of public comment that was a request to add the word pediatric in front of our first aid training. We are currently awaiting federal guidance on this topic in accordance with the Child Care Development Block Grant, and then any associated code of federal regulations prior to making that proposed change. In early June, we held a public hearing in which 3 individuals attended, but we did not receive any public feedback or comment at that time. I just wanted to give us also an update on the implementation timeline. Though the rules are being proposed for adoption today, The effective date of these rules isn't until January 1st of 2024. We will use that time to develop internal and external training, update any forms and resource documents that will be necessary for implementation, and then also do any updates we have to our IT system or database. That's all I had. So if there's any questions, comments.
Okay, thank you, Abby. This all looks strangely familiar or wonderfully familiar, I guess.
Third time's a charm. Third time's a charm.
Councilors.
Due to the robust nature of the amendments of the rule set for certified centers, the council action request, you'll notice, is actually a repeal of Division 300, which is all of the old certified center rules, and the amendments to the certified center rules will be in a new division. So that is why the council action request is so long, and this is a repeal and request replace action.
Right. Okay. Any questions, council, or comments on this amazing work and revision, which is very important? As we know, this one is focused on the certified centers, and then we will be getting others for other parts of the childcare system later this year. So this will be the template. Okay, I'm guessing we may not see Katie. So Anne, if you would, and why don't you, first we'll start with Remy. Will you put up the motion, Remy, on the screen?
Yeah, I've got it right here, but I just wanted to check in and ensure that we had a quorum. It looks like Peter has rejoined, so it looks like we have a quorum for the Early Learning Council members.
Yes, we do.
Excellent. Okay, I've got it right here.
Now, in this case, I do not have to read every single one, correct?
Yes, so you want to do the chapter, which is 414, and the division, which is 300 and 305, and then the first number of the rule through the last number of the rule in the set.
Okay. I move to repeal the proposed language dated June 28th, 2023, that repeals Oregon Administrative Rules, Chapter 14, Division 300, rule numbers 0000 through 0415. And I move.
Let's do that one first, Anne.
Okay.
And make sure on the record that it's 414-300.
Did I not say that? Sorry. Chapter 414, Division 300, rule numbers 0000 through 0415.
Perfect. Is there a second for that motion?
I second that motion.
All right. Thank you, Suben. Any discussion about the repeal of those rules? If not, those in favor, please say aye or raise your hand.
Aye.
Aye. Any opposed? All right, motion carries unanimously. So Anne, how about one more motion?
I now move to adopt the proposed rule language dated June 28th, 2023, that adopts Oregon Administrative Rules, Chapter 414, Division 175, Chapter 414, Division 305, rule numbers 0100 through 1620.
Perfect. Is there a second for that motion?
Seconded.
Thank you, Peg. Any discussion of this motion to adopt these rules? Those in favor, please say aye or raise your hands.
Aye.
Any opposed? Motion carries unanimously. All right. Thank you very much, Abby. You've done a great job of bringing us along over the last 6 months, I think it's been. And I know we'll see you again. We'll look forward to that. Let's jump back and do the contested case hearings. Again, the temporary rules. So Remy, will you put that motion up for us, please? And then we'll do that with the quorum. Okay, so Anne, once again.
I move to adopt the proposed temporary rule language dated June 28, 2023, that adopts Oregon Administrative Rules 414-075-0000 and 414-075-0010 and 414-075-0300.
Thank you. Is there a second for that? Peter?
Second.
Thanks, Peter. Any discussion? Those in favor, please say aye or raise your hand. Aye. Any opposed? Motion carries unanimously. All right. Last but not least on this agenda is the adoption of the employment-related daycare rules as these transfer from ODHS to DELC. And Kayla, thank you for being with us again. And we understand Jordan is on the phone with some computer video challenges, and therefore Kayla is going to be presenting this for us. Thank you.
Absolutely. Remy, if you could just pull up the couple of slides, we just have, I think, 2 to recap the work that went into transferring this. And I just want to start out from the very beginning with a super warm note of appreciation to our partners over at ODHS, from leadership all the way down to some of the field staff and OEP, One Eligibility Partnership, and just a huge thank you also to the teams that are coming over and will be a part of DELC on July 1st. So the end of this week, for helping us move this program and, doing the work to pull these rules apart and put them back together. So a big thank you from myself and from, the whole DELC team to ODHS and all our partners over there. So I think you've seen this slide maybe 6 or 7 times before. We are here at the time of adoption. We did bring chunks or parts of these rules to you over the last, I think, 5 ELC meetings, sort of taking you through all of the eligibility requirements for families, the requirements of providers, the sort of payment infrastructure that's written into rule, and some of those administrative components as well, such as overpayments and hearings and some of the rights and responsibilities that are associated with this program. Jordan did a wonderful job of bringing you all through that content. We did have a hearing for the ERDC rules. It occurred in May. Several folks attended. There was only one public comment provided, and that comment that was given during the hearing was also sent in as a written public comment. It is the only one that we received on this rule set, and it was related to the TANF categorical eligibility. And making sure that, we were thinking about the amount of hours that were available. As a reminder, TANF families are going to be eligible for ERDC on July 1st. And also ERDC families could get TANF now because it's a two-way street. Families on who are receiving TANF benefits are going to get a base part-time authorization of 20 weekly hours. And if they need more than that, they can request more and get up to full or more than full-time if that need is exhibited. So that is what the comment was in relation to. We didn't change the rule language in relation to the comment. We feel like it is appropriate for how we're rolling out the policy and the system functionality, and full-time authorization is available to families if it's needed. So that was the only comment seen at the hearing. And And there were a couple of edits after we sent the first version of the CAR this week. I know Remy followed up, but I just wanted to highlight them now. In making sure that all of the families who are currently receiving TANF child care benefits, but since the TANF child care program is closing down and we're converting all those families over to ERDC as of July 1, there were some slight issues related to TANF Jobs Plus income, because families could be on TANF Jobs Plus and receive an income as a part of being on TANF, right, and still being a TANF recipient. That would put them over some of the income thresholds, because that income is a counted income type. I know when Jordan took you through, we sort of explained each type of income that could ever be cataloged is sort of determined as, do we count this? Do we exclude it? If we count it, what is it? Previously, TANF Jobs Plus income was countable income as earned income, because we don't want that to count against families, because if they're on TANF, they should be eligible for ERDC Cat L. We actually just quickly made a change that makes sure that that income is excluded. So it won't count against TANF families, and the system won't sort of run the benefits and deny them inappropriately, because they are a TANF family and they should be getting categorical eligibility for ERDC moving forward. And so that was the small shift that we made between the council action request versions that were sent out this week. And so I did just want to flag that very transparently for the council, if there are any questions, and we can talk about it a little bit more if we need to. But that brings us to today. We need to adopt the full rule set. ODHS has put in their requests to Secretary of State to repeal their rule set out of Secretary of State's office. And so once adopted today, we will officially on July 1st have the authority for the ERDC program, and that it brings us to the end of our timeline. Remy, if you want to move us forward. This is just a high-level recap slide. Again, you've seen these rules, I think, in content and in summary many, many times over. And just as a reminder, we really focused on transferring the status quo with those limited HB 3073 driven policy expansions, namely the TANF categorical eligibility that I just spoke a little bit about in depth, and also the enhanced protected 12-month eligibility, essentially removing reasons why a case might close starting July 1. There was, I think, as we've talked about in a previous meeting, some feedback from the RAC that we incorporated. It was mainly sort of like cleanup and consistency. The Rules Advisory Committee was very engaged and flagged a lot of things that I think have a lot of potential to explore once the program moves over and is sort of fully settled within DELC. And so just want to sort of flag, there are things for this program that will come back to you. This is a program that needs, sort of like constant attention and updating when federal regulation changes or when the rates need to change. So you'll see this rule set come through, I think, at a pretty even clip. And some of those things, hopefully in the next year or so, are going to be some of the great sort of comments that came out of the Rules Advisory Committee that we held in March. And I think that's the end of the slideshow, Remy. Big thank you to the council. I know we took up at least a 20-minute chunk every meeting over the last 5 meetings, sort of socializing these rules and taking you through the weeds and really making sure that you guys were comfortable with the sort of parameters of the program as it moves over to DELC. And so just want to thank the council for really making space for us to present and sort of make sure that we're doing we're doing our job to make sure you guys know what you're adopting here today.
Yes, this is Jordan, just echoing my thanks as well. This has been a wonderful experience, and we're so grateful that you've taken the time to allow us to present to you.
Thanks, Jordan. And we know we will be seeing you again. So we will look forward to the continued conversation. And certainly want to thank Kayla for all of her work, because we're not going to see Kayla at future meetings. I understand she's decided she wants to work for the governor of Rhode Island instead. So Our loss is Rhode Island's gain, I would say.
Not quite the governor, but I will be moving on from Oregon. But thank you very much, Sue. I very much appreciate that. It's been an absolute treasure to come here and do this work with you all, but also like the very, very strong and wonderful teams over at ODHS, and of course in-house at ELD, Becoming DELC.
Yes, it's been a real partnership, to say the least. And I guess the other comment I want to make, and then open it up for other council members. I think the fact that the most recent public hearings that they held, both on these rules and also on the certified center rules, and the small turnout for those hearings, I think is reflective of the amazing engagement process that, and largely through the RACs, that the staff followed in putting these rules together and the revisions. So they were very responsive to the input that came in through the RACs, and I think these are reflective of that. So congratulations and thank you for all of that outreach. It makes a difference, definitely. So any other comments or any questions on these rules from council members?
Sue, I have two comments, I think. One is, I am so impressed that you all did this all on the right time schedule, and that we're getting this done today so that DELC can start on July 1st. I can't even imagine how much pressure there was on you to try and make sure all of this happens so that transition could happen. So I just wanted to say congratulations. The second thing I want to say is I have a colleague, a member of our staff at the Ford Family Foundation, who participated on on the Rules Advisory Committee, and I got regular reports from her, and she has said over and over and over again that the time was really worth it, because it really sets up a lot of the issues that we need to deal with going forward, whether it's the adjusted rate methodology, or whatever it is, but it really sets up the program's move to DELC. And so I know that she was poring over all of these day in and day out with all of you. And so I sort of have confidence and when I'm invited to make the motion to do so.
Awesome. Thanks, Anne. And thanks to your staff for being involved in the RAC. Any other comments or questions? And if not, Anne, would you make a motion? And Remy, will you please put it up on the screen for us?
Okay. Again, Chris, I can just do the chapter and division, right?
Yeah.
Okay. I move to adopt the proposed rule language dated June 28th, 2023, that adopts Oregon Administrative Rules, Chapter 414, Division 175, Rule numbers 0001 through 0105.
Awesome. Is there a second for that motion?
I second.
Thank you, Subin. Okay, any questions, discussion? Hearing none. Those in favor of this motion, please say aye or raise your hand.
Aye.
Any opposed to the motion? Motion passes unanimously. Well done, staff. Thank you all very, very much. Yeah. Woo. All right, July 1. It's right around the corner, isn't it? Yes, right, Katie. Yay. Whoa, we've talked about this day for quite a while. Nice going, staff. So council, we are done early, which is quite remarkable with our history. And I'd like to just take a few minutes, since we're done with the rules and the formal agenda, and look ahead a little bit. We're taking the summer off, unless there's some unforeseen reason that we have to come back together. So our next meeting will be at the end of September. I think it's maybe the 28th. If I'm right, it's whatever that last Wednesday is. And then we have our 2-day retreat over in Bend. Yay, Katie. And I just wanted to get a little bit of input from council members on, this is our first foray outside of the Salem headquarters since COVID. And so I'm wondering, what would you all like to see in our time in Bend? And Katie, we're going to be relying on you to obviously help put some of this agenda and connections together. And certainly you, Katie, will have a lot of ideas, and I'm sure Brenda, the head of your hub, will, and all of that. But Council, what are you hoping for when we're in Bend, besides hiking and great weather? Bye, Kayla.
We could always hold the meeting and on inner tubes on the river.
There you go. We'll have 100% attendance for this retreat.
I do have some ideas, if I may, because we have done some pretty unique programs here. We'll be hosting this meeting either here in the chamber in our conference room and or across the street from me at OSU Cascades. That will be beginning construction on their new childcare center that was built through ARPA funds and has the workforce component. So if you are interested, happy to bring some guest speakers in, and definitely Brenda Kamini, who is amazing, to come in and talk about the alliances and some of the stuff that's happened. If there's time on the agenda, happy to put that together.
Yeah. I mean, we'll make time.
That sounds great.
Yeah.
Let me answer Dr. Brown's question about joining us at the retreat. Dr. Brown, is the ODHS rep on our home visiting system planning team. Dr. Brown, we would be delighted to have you come with us. So please, it's October 24th and 25th. Are the dates, just so you can get it on your calendar. So thanks for asking. Yes, Katie, I'm guessing we would love to meet with some of your partners and hear about the alliances and see the child care center come out of the ground or whatever. Other thoughts? Yeah, Peter.
No, I think what Katie was suggesting sounds excellent. It'd be great, maybe have some time with the hub, just maybe just a discussion with the hub there, see what their perspective is on everything that we're doing.
Yeah, and I think that's a great idea, Peter, and probably besides Brenda, I don't know, bring her governance body chair or whoever the key hub players are, if they have any family advisory committee. I'm guessing they have one of those.
Yeah, they do a lot of work in alliance with the Neighbor Impact nonprofit here in town that does a lot of childcare. And the two, so Brenda Kamini and Karen Prow are hooked at the hip. And I think the two of them together will be able to really give you a good picture of how we distributed about 16 million in ARPA funds for capital stuff, infrastructure, workforce, a number of items. And they work really well together. So
Right.
you can do that, make it happen.
Okay. Other thoughts from council members, and based on other conferences and retreats you've gone on, what has made them really meaningful?
So we just had a recovery summit here, and it was an incredible panel of people with lived experience. And so I don't know whether it's possible to have a panel with local providers, local parents. But there's just something about listen to someone who says they've gone through recovery 7 times and what that journey was like before it finally clicked in on the 8th attempt.
Wow. That would be compelling. Yeah. Okay.
You're not necessarily saying it should be somebody from recovery. You're just saying,
No.
hearing from parents who are actually living this system. Yeah.
Yes. Thanks for the clarification.
Yeah, and I think the point you were making earlier, Peter, about parent supports, and part of it's your financial, obviously, but it's beyond childcare. It's what are parents really needing. Workforce is obviously going to be one of our big topics. So, Katie, whoever your key workforce coordinators and people.
Yeah, that would be Heather Fick from East Cascade Works. She's the pass-through for state funding for workforce development. She's part of the Get Stuff Done group that has been working on this for a long time. So I can definitely have her come as well.
Great. And I think what we'd be looking for, at least in part, is what's gone well, what's working well, and where are the barriers or the challenges, and just see if we can fit into any of those or help with any of those. It would also be cool to have some of your legislators involved. And I don't know if that's a panel or do we invite them to join us for dinner or have sort of a social hour when we could connect with them.
Especially Representative Levy. She's a staunch supporter. She replaced Zika's spot, and she took up where he left off on supporting childcare efforts. So let me see if I can do that as well. You and I can coordinate over the summer, Sue.
Okay, yeah, definitely would love to do that. But I think it's a great opportunity to let legislators know that we're around and to talk about Raise Up Oregon. By then we will have the document and be able to have a better sense of how we're going to share that and market that.
Yeah, I don't know if this matches up with the intent of us coming together in Bend, but something that I'm hoping happens at some point early on in the year is looking at the final draft of Raise Up Oregon and kind of aligned to that idea of that Gantt style chart you were talking about of like, these are things that have been started, these are things that are working, and whatever is being prioritized for the year. I would love to at least map out in my brain what is our focus for this upcoming year, right? Like what are the things that we want to look at and think about for the year. Yeah.
Good point, Subin, and that should definitely be one of the probably prime topics for this session. Okay.
And also I had a mini freak out over here. Did those calendar invites already go out? Oh, they did. Okay. I don't have them on my calendar, so I'll figure out where that is.
Oh, I'll make sure Gabby, you're on the call. So can you make sure, maybe just make sure that Subin's got, is that true for all of the council meetings, Subin, or just the retreat?
Oh gosh.
I don't think we've sent out, or I don't think Remy has sent out any cancellations yet for the council meetings, but Subin, I'll make sure that you have those, the 24th and 25th.
I have the meetings for the next year, but I do not have the retreat.
Okay.
And I don't know if that's true for all council members, but I know as they move from Remy to Gabby, but also from ELD to DELC, there are all sorts of cancellations and, re-invitations and stuff. So Gabby will just work together and make sure we've got the right cancellations, but the right meetings. Okay, thanks, Gabby. Thanks. And Subin, thanks for pointing that out. So we make sure it's on your calendar. And we'll get it on Dr. Brown's calendar too, as he's still with us. Dr. Brown, do you want to make any comments since you've been with us all day? And I don't know if all council members have met Irv. So, hi, Irv. Will you just introduce yourself to the council members? I apologize that several have not met you yet.
No apologies needed, Sue. I enjoy just being in the background, especially if Liesl is presenting. It's always good that, she has an advisor, a policy advisor in a corner for the just in case. And so I am, to you probably new, but I'm a policy advisor for DHS. And so there are 3 policy advisors that are connected to the governor's top priorities. Education is the lane that I'm currently in, and the other 2 advisors, they're connected with mental and emotional health. And then the last one, of course, is our homelessness crisis. So it's good to be in this position, just to be here, helping out, supporting the cause, especially as it relates to so many of our marginalized communities throughout the state. And so my background is in education, from teaching to being an administrator, you name it. And so when it comes to advocating for those families that are in dire needs, you'll find me on the front line, partnering with people that are in this space, people in our communities, and of course, those individuals who are our elected officials. So I'm someone in the background that's always cheering and supporting people to keep on moving forward. So it's good to be here. And again, Sue, thanks for the invite.
Oh, sure. Thanks for being here. And I think I mentioned earlier, Dr. Brown is a member of the Home Visiting System Planning Team. So, Dr. Brown, I don't think you're in the background anymore. Just to be really clear about this, I think you're now in the foreground. So I'll be seeing you tomorrow, and Peter and Peg will see you tomorrow at the planning team meeting.
Nice. Thank you. It's good to see everyone.
Good to see you. Thanks for being here. Okay, anything else from council members? Legislature's done. DELC's about to launch. We have a new strategic plan and lots, ERDC is moving over. It's exciting times. Thank you all for all of the hours and time that you're putting in to the council, but also to early childhood in your own networks, your own lives. And I'm sure I'm going to be seeing several of you over the summer, but the council will reconvene in September. So have a great summer and be well.
Thanks, everybody. Thanks, Remy. Take care.
Thanks, everybody. Thank you, Sue, for your leadership.
Yep.
Thanks,
Sure.
Remy.
Thanks, Remy. Bye-bye.
Thanks, everyone. See you later.
Bye.
Thanks, Peg. I'll definitely